All right. Hi. Great job, everybody. You've made a beautiful presentation.
Great.
And the investors were so impressed. And those of you who are in my workshop in July know what's going on. Or don't worry, we're not going to go through the whole workshop again, but I just wanted to offer the end first. All right. The end first being, imagine you're in place of the next audience you're going to be presenting to. Maybe it's an investor. Should we think about investors at the moment, or all of you thinking of some kind of funders, investors, grant committees at some point, right?
Yeah.
Okay. You just made your presentation about your initiative and you did a great job and they were very impressed. And the way that you know that they were very impressed is because right at the end of your presentation, they got in their cars, they got on their phone, they called some partner of theirs and said to them, wow, we really need to meet, insert your name here, right? Because what they developed is, what's the one sentence that the person who heard you present would now be able to tell someone who wasn't in your presentation, and they can quote to them based on having watched your brief presentation, and they'll get it right. So let's just go around. I don't know how well you know one another and how much you know one another's entrepreneurship. Not so much from what I just saw yet, right? Okay, amazing. So let's go around in the following way. Tell us what that bottom line would be. Okay, say your name, please, and your area of expertise. And what is that one line that if you succeeded in presenting your presentation in a way that would really clarify for an audience who doesn't know you and hadn't heard about your idea before, and they just heard and watched your 5-minute presentation. And I'm trying to focus on you guys, but I'm trying not to ignore our friends who are somewhere. So what is that bottom line message that whoever it is that you presented to would then be able to tell someone else on your behalf? Oh, I just spoke to Dr. Your name, and what they said was what they're working on is this. All right, let's try that. Just one sentence, not your whole pitch. Okay, let's try it in whatever order. It doesn't even need to be. It doesn't even need to be in order.
I can start.
Please.
My name is Wasim Mujahid. I'm a immersion physician. I'm a clinical from Hadassah and Karen. I'm thinking about a toxicologic alerts app that avoid of toxicological poisoning from either from poison plants or snake bites and scorpion bites. So any area, we have a lot of areas like these in our country. So when you go to travel or have trip with your family or your friends, this app will alert you that there's some poisonous plants or
In the
mushrooms in the area, or there's some kinds of snakes that alert you, and explaining how to deal with this to avoid them, or if you have been bitten from snakes or scorpion, have stings, how to deal with it.
So both to alert you that it's in the area.
Yeah.
And we'll have to wrap our brains around how you can possibly know that it's in the area.
It's connected with GPS and the geographic information systems, and it's a lot of work.
Wow, it sounds like it.
Yeah.
And in any given moment, a GPS system of some,
Wherever you go, so it's inside this map, they will give you alerts about these areas around
but
you.
even if it's known that there's a certain area that tends to have scorpions,
So-
right?
What it depends about what kind of information we have till now, and we put it in this app. And it's not that.
So it doesn't know that at a specific moment there
No,
is
no,
a
no, it's not.
scorpion around you.
No. It's about the area.
That's the risk.
Yeah.
If there is a risk, you're in an area.
Explanation about these poisonous plants and also the snakes and scorpions, and how to deal with these.
So it's both the alerts and also how to treat in case of contact.
The future would be connected with the hospital.
Amazing. Okay, thank you for that, Wasim. We really need you to succeed in developing that. Thank you. Okay. Who else wants to tell us? Please.
My name is Khaled.
Hi,
I'm
Khaled.
from Old City, from Jerusalem. I have a BA, a baccalaureate at computer engineering. I'm not a doctor. And I have a master in management. My startup is a platform that connect all stakeholders for children with disability and a tracker for their journeys powered by AI.
Amazing. So the issue here is connecting between all of the different stakeholders. So parents, teachers, paramedical,
Therapists, doctors,
and all different kinds of disabilities of the children.
yes.
Hi.
But you know, now the system is complicated. All of these of papers now.
Paper.
Yeah.
So it's
When
not,
they
there's
go
not
from
one
doctor to
central
therapist,
location.
paper to school papers. All of this.
So there's not one central place where the information can be shared securely among everyone who is meant to have access to that information. Important. Thank you for that. Okay, great. Hi, welcome. We don't need to bombard you as soon as you came in. We're hearing from everyone. Please, yeah, to hear you. You can listen. Perfect timing. No worries. We're not even necessarily going in order. We're just hearing from everyone in whatever order you like, who you are, and the bottom line of what it is that you're developing from the perspective of how someone who you just presented it to would now be able to take this bottom line and say it to someone else.
My name is Ryan Khader.
Hi.
I'm from Jerusalem. Gradually, I more believe in mental health. This is my journey. I started as an occupational therapist, master's degree in public health, community and public health, later neuro-linguistic programming. In one sentence, I love a productive community. So I believe if we have sustainable and accelerating mental health will result in a productive community, and this is a very, I believe it has a very direct impact on the healthcare system. I'm talking about different diseases, physical and mental. So I'm in the coaching field, but when I heard about the incubation program, I said, why not to integrate and to see how can I integrate the AI with my coaching field. But still, I have the idea, but
So it's still very early stage.
Yeah.
Okay, so we'll talk about it more when we talk about different steps of developing how to present your idea. But just as a preliminary, just so that we know in general what you're talking about, do you have a specific idea for using AI for coaching in order to help people facing a specific mental health challenge?
I have, but still need to explore it and to research more about it and to dig in more.
Cool. So it's still early stage.
Mental health.
Beautiful. Thank you. Okay, great.
Because
Microsoft,
honestly, sorry,
Microsoft do something.
just something. But honestly, I'm updating. I look and search, but I'm looking for more how to accelerate habits into a healthy lifestyle. You know, we all talk in this area about how to eat well, how to do sports, how the basic things. But I'm looking more how to accelerate to do this on the person on his own. We know that we need a positive reinforcement environment, a positive environment. But I just want to do this with the mindset of the person and with the AI. And how?
So to help people develop their own good habits and stick with them and be incentivized by some sort of digital system. Party,
How to accelerate
everybody.
So the main point here is to have to accelerate.
How to accelerate changing their habits?
Because it's a very deep exercise with the subconscious, It's not just.
It sounds like it. Okay, all right, great. We'll get into it more later on. Great. Okay, hi, welcome everybody who just joined us. What we're doing at the moment is just a really brief, hi. What we're doing at the moment is we're doing just a really brief single sentence of what are you working on? You can introduce yourself by name and by profession or professional title, and just one sentence about the current entrepreneurship that you're working on. So if somebody else was going to say, oh, what she's working on is, what would that one sentence be? Okay, so who haven't we heard from yet? Please.
انت اول انا اول هات المية Okay. Hi everybody. I am Dafna Session from Jerusalem. I came from multidisciplinary background. Let's say I started with the sound engineering, and then I studied media and journalism, and then I did my master in digital media and communication. Also, I studied in between web development, so I have an idea about web development and data analysis because I work on this a lot, and I have been participating in different research. Personally, I did some, and then I worked with groups here and in Britain also. My idea came of personal, let's say, observation about cases of elderly people. And the topic or the, let's say, the startup that I'm thinking of is is a time management application for medicine and for diet for elderly people. And it's AI, let's say, based. And it has different features that I thought of, which is not in other apps, like more connection between elderly people and caregivers, mainly families and other clients or things of, let's say, observing their, let's say, daily base with the,
The predominant healthy lifestyle, but predominantly a
lifestyle, yeah.
time management, a daily
yeah,
activity management
Yeah.
tool for the elderly specifically.
yeah,
Super,
the bottom line.
super. Thank you for that. Okay. Please.
I'm Ismail Musallam. I'm retina specialist for the last 40 years. I'm the founder of Neuromod Vision, and I'm interested in retinitis pigmentosa as part of retinal disorders. And retinitis pigmentosa in brief is night blindness started with and ended with complete blindness at the age of 40. We developed a device treatment for this condition based on increasing blood flow to the retina. And we did clinical trials, and the device proved its efficacy and safety. And we patented this invention and going for, going ahead to multi-center.
Amazing, amazing. Thank you for that. Okay, so the single sentence that someone would take away is here is an eye specialist who is developing, even if we're not experts in the field, we could still understand that what we've got here is an entrepreneurship project that surrounds helping people who are going blind from a specific eye disease, right? And you're saying that, and I think that I remember you saying when I met you last in July that it's not, that it doesn't require surgery, right?
It's non-invasive.
It's a non-invasive way of addressing this type of,
For treatment for a disease that is not treated.
that currently there's no treatment. It sounds too good to be true, right? Amazing.
It's true.
But it is true. Yeah. Super. Thank you. Okay. Who else haven't we met yet? Welcome.
I don't know what we're talking about.
What's your name?
My name is Kinda. Kinda.
Kinda. Hi, Kinda. What do you do?
Okay, I'm 25-year-old woman that have studied medicine at Al-Quds University, and now I'm doing my internship here at Hadassah.
Wonderful. What field are you going into?
Okay, so I'm basically interested in dermatology, but it's a bit competitive department and competitive field in the country. I would like also to get into ophthalmology, emergency medicine. So I'm up to.
You've got a couple experts here to consult with. Lovely. Okay, great. And in terms of entrepreneurship, are you working on a project right now?
So currently I'm not. Actually, I'm not part of this group. I'm part of the other group that we still like taking the lectures regarding how to come up with the idea, how to build your like innovation.
Oh, okay,
idea.
great.
So I'm not.
So we're glad to have you with us, and thanks for choosing such a great profession. And I hope that you'll find this evening interesting, learning from your friends here. Super. Thank you, Kenneth. Okay. Hi.
Hi, I am Raida.
Hi, Haida.
I am pharmacist. I am also not from this group. I study Hebrew, studied Hebrew in this community. Now I don't have any program.
Yeah.
Yeah, I have idea. I want to study nutrition, how to treat the people, the people by nutrition. And not by drug. I am pharmacist, but I hate the drug. How change the nutrition, how change hairstyle, lifestyle. This is the idea. I am beginning to study it.
To think about how to encourage people to live a healthier lifestyle.
Yeah,
That's important.
but I
Okay.
am in the starting. Not,
Great. That's very exciting. Super. Okay. Thanks for that. Lovely. Hi.
Hi. At the university, and I'm just here to listen. I have no startup.
I'm really glad you're here. I'm really glad you're studying biology. Just tell me your name again.
Vanna.
Vanna. Thank you. Okay. And good luck with your studies. All right. Which leaves us with our friend who traveled all the way from Aqua to come see us. He came by drone.
The watch.
He came by hang glider.
Hey, my name is Rames. I'm a registered nurse in head trauma in Shiva. Then decade, 10 years. My idea is accessible and portable and small watch defibrillator.
A watch defibrillator. Now, since we spoke with Lamas a little bit before, we understood that he's actually talking about a portable defibrillator, right? We all can imagine these big boxes that we see on walls all over the place, right? But Lamas is not talking about something for, as soon as he said watch, a few of us with and without medical backgrounds thought, what, this is for people that are concerned that they have, if they suffer from arrhythmias, they want to be sure that they always have something nearby, but it's not so extreme that they need to actually have it implanted. And Lama said, no, I'm actually thinking about it as something accessible for first responders so that nurses, right, and paramedics and people that would be the ones who would naturally be the ones to give the first aid in that case, right? So maybe you add the term for first responders, right? So I'm looking to miniaturize defibrillators so that they are on a watch, right? A watch-sized defibrillator for first responders, right? So that there are more defibrillators circulating in the community to minimize response time in the case of heart attacks, right? Brilliant. Okay, great. Make it happen. We're with you on it. We want to see this thing. We want to see this thing happen. Super. Okay, who haven't we met yet? Hi.
I want to see it. We don't want to use it.
We don't want to use it. We don't want to use it. We want it to be as beautiful as an Apple Watch, right? But we want it to stay closed in its case and just, to be beautiful. Okay, great.
Actually, I have a nonprofit project, third year for me, called the Global Pulse. It's nonprofit all over the world. Okay, so we can exchange information.
Super. All right, great. See, entrepreneurship is all about networking and exchange of ideas, right? So it's working already. Hi.
Hello everyone. I am Hind. I am industrial engineer. My background is in data analyst and data scientist. Right now I am working in a health tech startup. I don't have an idea yet, and I am here more to be part of the community and listen and learn.
Wonderful. I'm so excited that you guys are all here. Lovely. All right. Hi.
My name is Adele. I study urban planning. My idea is to build a health application to take care of the health of people with a chronic disease.
So an app for someone with a chronic disease like diabetes to manage their own condition, for them to manage their own condition?
Yes, every with the chronic disease, the application will take care for all the
Different aspects of their disease?
and to take him Yes, nutrition and
But it would be for the patients to for the people to take care of themselves, right? Not for an interaction with the medical professional, for people that have a chronic disease to help them manage their everyday life and be as healthy as possible.
whole lifestyle.
All the aspects of their lifestyle. Amazing, amazing. All right, all right. Jacqueline, where did you find all of these lovely people? Did you just walk down the street and go, "Hey, fun people, you guys want to come attend a workshop?" Fantastic. What a great bunch. Thank you. Okay, great. Good luck with that. Very important. Okay. That's an important idea. Are you sure that there's not something like that already? Is there not already some sort of app for helping people who have a chronic illness manage their healthy lifestyles? There's not an application like that yet? Okay, okay, very cool. All right, how are you? Good to see you. Good, good. You know what? Introduce yourself because I already had the pleasure of meeting you in July, but I don't know if everybody had.
Okay, so I'm Layla Hidney. I know most of you guys, but I don't know the other ones. I think there's some new faces. I'm working on a project PR startup, an idea, so hopefully that will really work in the future. That's all. I don't know. Is there something I have to introduce?
Tell us what the idea is, just the bottom
Okay.
line of the
It's,
idea.
medical disposal waste of connecting with insurance company and companies that recycle pills and syringes that you use at home instead of throwing them in the toilet and affecting the human and the environment. So I'm finding ways, software so you could easily use at home and also with elders who are taking care of with medical like
Did you say software?
yeah, a mobile app actually.
But the mobile app, if I've got medical waste at home right now, how's an app gonna help me solve it?
So basically what I'm trying to do is when I'm creating this easy using app is to connect with people who are at home that are connected to Maccabi or the Meet or Khalid. They can download this app through the insurance companies. And if they want to dispose a certain medicine or pill or whatever they are using, they can contact through that app the companies that recycle them. They're
Okay.
free in Israel.
So it's to make it easy for them to get rid of this
Yes.
waste in a safe way,
Yes.
to find out where they can
Yeah,
do it.
because it's really hard to do that if you don't have the method and the easy of doing it. Because people would say, "Oh, I don't want to do it because it's complicated." Not everyone knows how to use the apps or softwares in general. So I'm trying to make it as easy as possible, so we can reduce the risk of contamination to the environment and also to the people who are drinking water, because that's the most contamination of water is because of medicine, the disposal of medicine into the toilets or other methods.
Okay, so we'll talk about it more at length later, but do we understand correctly that what you're saying is it's an app to help people who maybe have a lot of drugs that they use at their home regularly, so maybe back to people with chronic illnesses perhaps. And if it's a matter of disposing in a safe way of medication that is expired predominantly.
Exactly. Yes.
So instead of just tossing it themselves, this would be a way of making it easy for them to dispose of it safely.
Yes.
Okay.
Why patients will have the interest to do that?
So that's a good question though, because at some point you'll be like, why would I really want to, use that? But that also depends on the benefit that I can do also for the customers using that app, that they can benefit like with getting points with their insurers and so on. It makes them engage.
Some sort of incentivization for them.
And
And what's the benefit of the insurance company?
it reduces first for the disposal of medications, because most of the medication, they are losing like 1.5 billions of medication that is used and just tossed in the toilets and other ways. So there is actually instead of like paying extras for those medicines, they can reuse it by recycling it.
Wait, so now it sounds like you're not talking about disposing of it, but you're saying if they have medication, repurposing it, you're saying if there's medication that is still valid, that is not expired?
Well, most of the focus on it is basically for the pills that are expired. But if there is already, because some syringes, for example, when you use them, for different chronic diseases. There's I forgot how much would that be in milliliters that's still inside that syringe, and you still throw it, and it's costing you money as a customer, and it's costing the insurance company that is providing that for you. So I'm trying to find a way that customers can benefit by bringing it back.
Interesting, but I don't think that anybody that receives back a syringe that's already been partially used can reuse that portion of
No,
the
no, no,
medication.
not reuse that. No, not reuse the same medicine. It's going to be recycled in a way, not like recycled in a way that you can reuse it, but it's taken back to the company that will be recycling. There's three companies that recycle medicines that are expired, but nobody really reached them out here in Israel.
And they can reuse in the
Not
next.
reuse, recycle the material itself.
Got it. Okay.
Yeah.
Okay. Sounds like something we
Very
need more
interesting,
information
very
about.
wide. Even I am still doing the research on it because it grabbed my attention. As I said, that you'll have to also bring the customers to do that, and at the same time the insurance company. So I have business to business and business to customers. So I have,
Interesting.
yeah.
Okay. All right.
I have doubt about the value of your project. For example, in the hospital, we have a local project in Hadassah Hospital
Yeah.
to reuse all the surgical instruments and to do recycling and to use them again.
True.
Okay, but it's instruments. Like every instrument there costs thousands of dollars.
True.
Okay, but if you take the same concept and do it for medication that people take at home or patient takes at home,
Yeah.
I don't think that it will be cost effective for. I don't want to
No, please don't.
just share my idea. I don't think that they will. It will be economic.
So there's a question about the
Yeah.
financial
Yeah.
incentivization of it.
Yeah,
All right,
it's good.
but I don't want us to get into it right now, but this is a good conversation to
Yes.
continue.
Yes.
And for those of you taking your first steps in the world of entrepreneurship, you already see how the clinical questions are very much intertwined with the business questions, right? Sometimes a startup won't actually succeed, even if there is a real medical or other need, but if there's not a logical business use case, right? If, for example, the person who needs it is not the same person who's paying for it, right? There are all kinds of finer points here that need to be addressed about whose pain point is it? And is the person who's currently suffering to have this thing addressed, is that the same person who's currently paying a lot of money in order to have this issue resolved, right? It's a big question. It's a big question. And something else very important for anybody who wants to do entrepreneurship is we need to not despair when it turns out that the first idea that we have turns out not to be viable, right? We need to think, interesting. All right. So if it turns out that, as you said, doing a lot of research, right, and finding out, how is it done now? What's complicated about that? What is interesting about that? What other alternatives are there? How is it currently being done? And then sometimes we reach the conclusion, okay, so the problem is the problem that I want to solve, but maybe this solution, right? For example, it could be that the problem that Lila wants to solve is the problem of contamination of hazards in the community, in the water, in the waste system, right? But maybe the question of recycling medication might not be the pathway,
Exactly.
right?
Yeah.
It could be that Lila will think of other ways of how
Exactly. We're
to.
still adjusting. Like there's nothing like it's for sure, and that's why we're still in the first stage because we have to keep adjusting. You see something and then you change because during the research you know that there's some things that you can't
Right.
do and
Right.
do so.
Super. Okay. And there's still some, thank you very much. There's still some friends over here that everyone hasn't met yet this evening. So those of you who have not introduced yourselves yet, please. Yeah.
I'm Mohammed Zaghal.
I'm Colin.
I am a neurologist at Sharet Sadiq Medical Center.
Thank you for that.
Actually, the project that I'm working on is something that I faced during my work, which is the lack of direct contact between the hospital and the referring physician or Kupat after signing the report. So, for example, if you went to orthopedic and he sent you to do a CT scan, and the report was signed after 3 days, let's say. The referring physician didn't get the report, and you are feeling well, you didn't ask about the report, what are the results, and maybe something very serious is missing there, like suspicious nodule or mass or fracture, and this may be misdiagnosed or underdiagnosed, and after a couple of months or year, you may like the patient may come back with a very serious complication or maybe advanced stage. So the system is working on a direct communication and reliable communication between the hospital or the radiologist after signing the report and the referring physician to make sure that there is no misdiagnosis or something like that.
Beautiful, beautiful. So in a single sentence, it would be something like, we are developing the first direct contact system between the diagnosing radiologist and the referring physician in order to make sure that the entire diagnosis has exhaustively been communicated between them?
Yeah.
Beautiful. Thank you for doing that. All right. Fantastic. And hi.
Hi, my name is Abu Khalaf Samar. I'm internist. I'm thinking about a device to detect as to prevent recurrent urinary tract infection.
On behalf of all of humanity, thank you for that. Super. Okay, you want to give us a direction of how you're going to prevent them? Are we talking about a device? Are we talking about a system?
It's more like a device thing. We have a couple of people that may use such a device, starting from children to elderly to women to after surgery.
Is it specifically for people that are at higher risk of recurring UTIs?
I believe, yeah. I mean, most people that have recurrent UTIs are like in the category of kind of illness or chronic disease.
Mm-hmm.
So these people that may use such a device.
But you are talking about a device.
I think, yeah, more like a device.
Okay, very cool. All right, we're going to want to hear more about that. Lovely. Okay, thank you. Hi, everybody. All right, so here's what we're going to do. Since I see now that we've got a mixed group, some of you are working on entrepreneurship, some of you are thinking about entrepreneurship. So let's do the following. I would love to offer you a framework for thinking about how to construct an effective brief presentation when you're going to be presenting to, say, an investor, right? Which is often one of the important target audiences that you present your entrepreneurship to. Very often, you'll only have a short number of minutes. If any of you have ever heard the term a 5-minute pitch, right? The pitch, I think it probably comes from the world of American baseball. We're actually serving a ball to the person with the bat who's from your team, and you're trying to get them to hit it, or to the person from the opposite team, and you're hoping they're going to miss it, right? So that's the pitch. The pitch is sending it, throwing it to them. And in the case of entrepreneurship, you're hoping that the idea that you're communicating is actually going to be received and understood by the other side. I want to give you now a checklist of important messages to include in a brief presentation. So those of you who are already working on entrepreneurship, I actually want to encourage you to think about these questions now and answer them for yourselves. Those of you that are exploring a future potential idea, you can take a specific example of either a startup that you've heard of. Maybe you have a friend who's already working on a startup idea. Maybe you want to use a specific example, even just for the purpose of the exercise. And through these questions, I would love for us to be able to start thinking about how we can then build a presentation that answers these questions. And then in the second part of our evening, I would love for us all to watch a few examples of the presentations of our friends here who are already working on advanced or early stages of their startups, so that we can learn from those presentations and make some suggestions on how to sharpen them even further. Okay, so let's start with the following. Can all of you please write down for yourselves one sentence, okay? Because all of us, it's much easier to speak for 20 minutes about something than it is to say one sentence, all right? See if you can limit yourselves to one single sentence that answers the question, what specific problem, okay, and whose problem is it, are you addressing with your entrepreneurship? One sentence, not a paragraph. Write it down. Okay, what is the specific problem you're addressing? Okay, write it down. All right, and those of you that are thinking about future entrepreneurship, try to phrase for yourselves in a single sentence. I'm addressing the problem of X experienced by audience Y. Okay, so for example, if we heard Dr. Ismail's example before, right, then we could all come away clearly with the sense that the specific problem was that particular eye disease that he mentioned, right? What's it called?
Yeah, retinal pigmentosa.
Okay, so retinal pigmentosa, what?
For night blindness.
Night blindness, right? Night blindness. So Dr. Ismail is addressing the specific problem of night blindness, okay, among those who suffer from it. This is not for the general public. It is not for anybody who's curious about it. This is a specific solution. Hi. There's a specific solution for people. Salam alaikum. A specific solution for a specific audience. All right. People who suffer from night blindness. That's whose specific problem Dr. Ismail is addressing. All right. Who'd like to give us another example? What specific problem of whose are you addressing with your entrepreneurship?
ICU neuropathic immobile patients.
Super. All right. That's very specific. All right. It's not even for all the people in, all of the inpatients in the hospital. It's for people in the ICU who are immobile, right? The people who are bedridden in the ICU, that's the people that this particular solution is for. Okay. Now let's get even more specific about what problem, right? Is it because of their immobility that's the problem that you're targeting? Or is that why you use neuropathy?
It's because of the overall health condition that they have.
So the specific problem is their immobility?
Immobility and neuropathy.
So so you're addressing the immobility and the neuropathy of the ICU patients. Yeah, that was perfectly defined. Super. Okay. Who's got another example of what specific problem of whose are you addressing?
Everybody.
Yeah, among the general public. Yeah. Okay, so you're talking about the specific problem of, well, actually, it seems to me like what you're addressing is the problem of the time that it takes to get a defibrillator to the person who's experiencing a heart attack.
Exactly.
Right? That's what you're addressing. Right? You're not even addressing, I mean, of course you're addressing the heart attacks, but the reason that you're saying we need them as readily available as a watch on somebody's wrist, right, is the time saving and the accessibility aspect, right? Rather than in a box 15 minutes away somewhere, right?
Yes.
Super. All right. What else? Specific problem of whose?
For me, it will be the whole population, but especially specific and travelers and adventurers.
Okay.
Because as I explained before about that app, so they need this.
So the specific problem that you're addressing is the lack of knowledge about local.
So what I wrote here, lack of updated online information and others.
Lack of updated online information. And it seems to me that the geographic aspect was also of the essence, right? So this is also about you're addressing the lack of real-time relevant information about toxic threats, right?
Yeah.
For anyone in the general population who is experiencing them, right? Amazing. And then, do I recall correctly? What other cool examples do we have here? Dr. Zagara, would you say that the specific problem that you're addressing and of whose is, it seems like it's a two-way it's actually the problem of the patients, but you're looking at it from the perspective of the physicians themselves, right?
No, the address here is mainly the hospitals, but really including referring physician
Mhm.
and insurance companies,
Okay.
mainly government, also
Oh,
insurance.
interesting. I didn't even think about the insurance
Yeah,
companies.
because this problem here, it's like very dangerous in a set of medical legal.
Ooh, because there could be malpractice.
Yeah.
If it turned out that if in that original scan it did show up, but it wasn't communicated?
Yeah.
Interesting. All right. So the specific problem, we'll talk about the stakeholders, but the specific problem is you're addressing the lack of direct
Yes,
communication.
it's a lack of direct and reliable way to ensure that there is a direct communication between the radiologist and the referring physician.
In order to make sure that no relevant,
That he gets the report and he will continue like what is suitable for.
that no relevant findings were overlooked. Super, super. Okay. Should we talk UTIs? So the specific problem, now you're not addressing the problem of UTIs, right? What are you actually addressing?
The early detection of growing bacteria in urine.
Ooh, okay, so that takes us in a different direction.
Yeah.
So are you saying that the problem is that today UTIs are only identified after there's already a full-fledged infection
Yeah,
with all of the suffering and need for treatment? And you're saying that there's a way of identifying it
yeah,
before?
Yeah.
Wow. Okay, so that takes us in a totally different direction. So you're saying it could be prevention rather than treatment?
yes.
Wow. Okay. So addressing the problem of detecting urinary tract
Yeah,
infections
early
only.
detecting the growing bacteria and
Super. Super. Okay, great. Other examples?
Lack of communication between health caregivers or stakeholders for children with disabilities.
Amazing. Amazing. Okay, which is of course the children themselves problem, but it's also the problem of any of those other stakeholders who don't currently receive the information that the other partners in taking care of the child are privy to. Super. Okay.
Problem could be like this medicine and this the elderly people with chronic disease that are missing.
Again?
Medicine and this the elderly people with chronic disease are missing.
Are missing. Okay, so the specific problem of suboptimal management of daily care for the elderly, that's what you're addressing.
What do you mean? That I didn't understand it. Sorry.
Elderly people, sometimes they are missing their medicine or dates of this or other let's say, vital things that happen every day because there's a relation with the application, but I didn't go in details with yet. So this application will prevent these missings daily and also keeps connection between caregivers who are following up their situation in order to be all in track and to prevent any, let's say, sudden down in their situation because they are not taking medicine on time, and also keep their families or caregivers, whatever, maybe they are doctors or their family members or whatever, and safe and in connection to follow up if they need any urgent intervention.
To prevent worsening of the deterioration.
Yeah.
It almost sounds like a means of encouraging adherence, right? It
It's
almost sounds like
reminders,
addressing,
reminders for the patients to take the medication.
and not only medication, right? It's in addition to medication, other.
Or diet programs. If someone who is doing the diet program, also it helps give them, let's say, doses or let's say kind of meals on time.
It sounds like a means of encouraging adherence,
Yes,
right?
exactly.
maybe clinical visits.
Yeah.
Super. Okay, great. Anyone else who, if you're still thinking about it, you're thinking about it, right? If it's still early stage. Okay, here's the next question. All right. And then I'll show you at the end of these questions how you can connect between the answers to these questions and the backbone of an excellent short presentation about your startup to a stakeholder such as an investor. All right, question number 2. All right, sorry, friends on Teams, I'm going to move you a little bit. There you go. Okay. So here's the question. And this is a very core question apropos of the connection between, say, the clinical question and the business question. In 2025, it's very difficult to be the first one who has a eureka moment and goes, wow, here's an idea nobody has ever thought of before. And that's okay. That's okay. Most entrepreneurship is not reinventing the wheel. Most of entrepreneurship is identifying a specific niche within a market and going, if you map out this market, currently it looks like there's a decent solution for this part of it, and there's an okay solution for this type of category, but here is a pocket that is really underserved. Okay. So here's my question to you. When you think about the ecosystem in which you're talking about operating, okay, what is the current golden standard, or what are the current approaches to addressing the thing that you're talking about? No, it doesn't necessarily need to be a list of other startups that are already operating in this field. It could be conventional solutions in the hospital. It could be solutions within the community. It could be people just don't address this need and therefore they deteriorate. It could be, what is currently the most likely way that this issue is being addressed? Okay. And what are the disadvantages of this current reality? The reason it's very important to map out how is this currently working is because very often when we see entrepreneurs presenting their startup and they go, here's a big problem, so here's how we're going to address it, then people in the audience who don't know that field so well are thinking, really? Are you the first one to think of a solution? There's nobody else doing it? Whereas if you go, here's a big problem, and today this problem is mainly addressed by means of this category, that category, or this category, and here's why these categories are suboptimal. They're really trying, but they're still not delivering to the level that we would like them to. They're not accessible to everyone. They are harmful to the environment. They only last for 2 years and then you need to do the corrective surgery a second time. They provide a partial solution, but not all of it. So take a moment and think about your specific use case that you're thinking of, right? What are the current common approaches or golden standard? And what's suboptimal about it that requires taking it to the next level by means of your solution? So don't yet talk about your solution. This is still about what exists today. Okay? Take a moment and think about what exists today and what's missing from what exists today. Yes. Okay, would somebody who already had time to think about it like to tell us, please?
Yeah. So what are the current common approaches right now for my startup? It's like a website and general information and the local authorities in special areas. Okay. And it's disadvantage of this, it's not giving us an updated and, as I said, online alerts, and it's hard to memorize. Even the local authorities, or that I have the websites over there, I can memorize everything, and that's in this area that I have like special poisonous plants or these kinds of snakes over there. So
local authorities.
Yeah, so even we'll go to some place to have trouble.
Say the Jerusalem Mountains. If it turns out that there are certain kinds of snakes that love the Jerusalem Mountains, so who knows that those are the snakes that are common to the Jerusalem Mountains?
So here, the municipality of Jerusalem will give us information about these places, but it's general.
Mhm.
And as I told you, it's hard to memorize everything.
Right. Okay.
I think there is always a referral in the Ministry of Health that they call even the middle of the night to tell you what kind of snake or
It's not the snakes, it's about just the health ministry have just one consultant about the rabies. It's called the rabies consultant. Yeah.
In case anybody gets bitten by a dog or a fox or
poison.
something.
Not all the poisons. If you
Interesting.
need any consultant, you can call the poisonous center at Rumble.
Okay, so the current common approach is that there's one center in the entire country
Yeah.
based in Rambam and they're the ones that you can call when somebody's been bitten by something in order to consult with them. What should they do?
Even poisonous, everything.
Okay.
I think I have seen this before. There is. I think here, I've seen this kind of.
In Israel, absolutely not.
Wasim would know.
Definitely.
But is
Super.
is it that common in your daily practice to?
Listen, at Hadassah, I'm the consultant of the rabies. Every bite from a dog or dogs or cats, I'm responsible for these consultations. Before me was Kobe Asaf.
Mhm.
And even we have these reports. I need to report the Ministry of Health about this. Recently, we have I would say that a different consultant that they asked me at mid of the night about a mouse bite.
Mouse bite.
Yeah, mouse bite. It's not.
Get rabies from a mouse.
No,
Hantavirus probably.
no. It's another a flag or something. But I said no need for rabies vaccine. And after that, they called me back. They told me that the Minister of Health sent them to the hospital because the mouse was
The cat.
at the 5th day. So this incubation period for the
Right.
virus, there is 10 days. If we can hold the animal for 10 days and it's still alive, it's okay. So no need for the vaccination.
But if the animal dies, then the protocol is
Yeah,
you need to get
before the
rabies
10
shots.
days, you need to get the shots, yeah.
So this person needed to get rabies
Given
shots
the
even though it was a
shot, the
mouse?
Minister of Health sent him.
Wow.
So your application is targeting healthcare providers in order not to call you at night.
First of all,
That's an interesting spin on it. That's an interesting marketing tactic.
to get more safe, yeah.
All right, so the current common approach is that we've got one national registry for poisonous substances that requires hands-on. Now, would your app remove the need for one-on-one consultation with a physician? Not
Absolutely
necessarily.
not.
Absolutely not.
not. We can't exchange the app with the human and the doctors. And at any time, we still need the doctors. After that, we need to refer if we have bitten from snake or something.
But what it could provide us with is the relevant
By
first
prevention,
prevention.
and avoid.
Okay. Okay. All right. So the current common approach is we've got one central registry of the information, and therefore, it's overloaded, it's not localized, it doesn't offer prevention, only response. So you're actually saying that your app could really put a lot of the load onto prevention and give people, kind of educate people to prepare for.
First of all, it's prevention. Second, is the rising awareness about these areas and the animals and plants. Third, as I told you at the first, the future we will improve this app. It will be connecting with the hospitals.
Okay. Okay. Great.
Sorry for interruption. I don't know how far we have the space to ask questions because we are in the middle of something, but I'm still curious when you started pointing out your idea. So about the data,
Yeah,
where are the sources?
that's what I said. No, that's what I said. It's a lot of work. It's on the data.
Yeah, but
It's from the.
sometimes you have data, sometimes you have to build a team to gather the data. So
It's a big team.
this is my question.
It's a big team with a lot of information.
He's going to employ mice, basically.
Oh,
He's
okay.
going to employ a whole lot of mice.
We'll start with the masks.
He's going to incentivize them with cheese. Okay, let's look at that's what the budget, cheese AI, that's what the budget is going to include, cheese for the mice. All right, so question number 3. All right, we're not going to go through each one every time, but you guys are going to answer them for yourselves. Okay, now here's a challenge because we can all talk about our solutions for 20 minutes, but can we say it in one sentence? All right, so here's my question to you. Define, please, what your solution is. Not yet how it works, not yet what its advantages are comparatively when you compare it to other solutions. Define what it is. Is it an app? Is it a device? Is it an approach? Is it a software? What is it? Okay, because very often in pitches, immediately an entrepreneur will enthusiastically start talking about, and it does this, and it's got this feature, and we don't even know what it is. So fundamentally, first, define what is it in one sentence. Can all of you please define those
In
of
one
you who are
word.
already, what?
Yeah.
It's an app. Okay, so an app is helpful.
That's the only way.
This is the easiest question.
It seems easy, all
This is the
right.
whole idea, you know?
This is the one thing that your audience really needs to take away. So bottom line, what is the thing? All right? So who can give us a single sentence of what it is?
Multifunction machine.
A multifunction machine. So we're talking about a machine that will,
Multifunction. Yeah, machine.
this is a machine that's going to perform various exercises.
It's gonna, yes, it's gonna do passive active exercises and other things that may help in recovering the patients.
So it's going to kind of manually manipulate different parts of the body of the patient.
This is one thing. The other thing, it will do neuromuscular stimulation, for example, and it will do by itself DBT prophylaxis.
Wow. Okay.
So it will cover several things together. It will use different technologies in order to improve mobility and recovery.
Amazing. Amazing. So what it is a machine. We've got a device, right? And as we understood that the problem was the lack of mobility with all of its repercussions for patients lying immobile in an ICU, we're talking about a device that will proactively stimulate the patient's limbs, organs, and even their blood circulation to prevent deep vein thrombosis as well. Okay, very cool. All right, so there's the definition of what it is. What is it?
Toxicological prevention guidance app.
A toxicological prevention guidance app. All right, it's an app. Cool. All right. How about, so what is it?
I think it's like a system, software, and application. It should be like both in the hospitals and in the phone of every physician. So it's a combination: system, application, software.
Do you imagine that the communication between, does it need to be synchronous or can it be asynchronous? The communication, when you imagine a situation in which you've done the radiological analysis and you've got the referring doctor in the community, do you actually need to get on the phone and speak with them, or is it enough if they read your report?
Depends if it's like a very urgent case. Here you have to make a call.
You do.
If it's semi-urgical, incidental, depends on the case.
So maybe a helpful, what is it? Could be a platform. Is it a platform for bidirectional communication between radiologists and the referring physician in the community?
Yeah.
The insurance agencies are not part of this interaction,
No,
right?
But
They're beneficiaries.
For
malpractice suits or suits, yeah.
They will be interested
Lawsuits.
for all these malpractice suits.
So maybe we'll get them to invest in it, but they're not actually part of the bidirectional
not at all.
communication.
But they will be interested in an
Right.
application like this to make sure that there is no missing, like cancer, just because there is no direct
So that the
communication
insurance
between
isn't claimed for it.
radiologist and
Got it,
the
got it.
referring physician.
Okay, so it's a platform for bidirectional direct communication between radiologists and the physicians who referred to them, right?
There's no such a system worldwide.
No. Worldwide, I searched, I didn't see anything like that.
Very cool.
Here, absolutely, there's nothing like that.
Okay, all right. What is it?
You.
Any of you?
We do this first. It's an application. That's
A device that reverses irregular heart rate.
It's a device that reverses
Irregular heart rhythm, not rate.
Arrhythmia.
Rhythms.
okay, so it's a device that regulates heart arrhythmias, right?
Not
What?
regulated. The heart rate will be irregulated, so it's
reset.
Reset.
and then
So it's a device for resetting heart rate, but specifically the issue is it is a watch. It is a combination between the known, or it is a miniaturization. Maybe that's what it is. It's a miniaturization of the known defibrillator device, right? Because then you can assume that anybody who knows what a defibrillator is knows that it's in order to reset the heart rate, right? Miniaturized to the size of a watch to be worn by first responders, something like that, right? That's what
Like
it is.
your idea, so because it's very interesting.
It is interesting.
Your idea is like if you have a collapsed patient, you take your watch, you put it in his.
No, you take the watch will be the defibrillator itself.
So you put it in
An
his hand.
ICD, portable ICD.
ICD, it will be.
I have a better idea for you.
No,
Maybe other
Yeah,
than watch.
okay, the
Maybe
watch-
you do a cover for
For the
iPhone.
Okay, the problem is to get.
You know, we have covers that are
That are
very
metal,
with the
yeah.
battery. You can do all your idea with the cover of the telephone because I will not use a watch, never.
Yeah.
But I will use the cover. I think
No,
it's the.
if I bring this solution technology.
I will be a co-founder.
You really want an emergency medicine physician as your co-founder.
Yeah.
It sounds like a good deal. It sounds like a very good deal.
We can get a lot of idea, please. We get this.
There you go. Okay, so that's what it is.
Something like Jamil.
What it is a mini. We're making great progress here from, we don't understand what the idea is. We're joining you as a co-founder.
Wants to be a co-investor. with
That's
everybody.
it. Now we've gone from, we don't understand your idea to I want to be a co-founder. You're doing some really good
At the
marketing.
end of the day,
You're doing some really,
go to find out with multiple.
that's it. I think we're all joining your
He's a
startup.
Khalili thinking guy.
Typical.
Right. So what the solution is a miniaturized defibrillator in order to enable first responders, regardless of where the closest defibrillator is, to always be ready to offer.
So think about it. There's some people they travel and they take the walkie-talkie within the emergency.
Right.
Call the airplane or something in the mountain.
Right. Right.
If you have a defibrillator.
Like a
in your hand,
satellite phone.
You have it in your hands.
Mhm.
You don't.
Oh, you've
They
convinced us all. You've
It's a
convinced
great
us all.
idea.
All right, so we know what the solution is. So how would you define, Dr. Ismail, what is the solution?
It is a non-invasive ocular neuromodulation device.
It's a device. It is a device.
Yeah, but it is non-invasive, ocular for the eye, and just categorized under the term of neuromodulation.
Neuromodulation. All right, so it's a neuromodulation device for the eyes that is non-invasive. Okay, and it only takes everything Dr. Ismail knows how to do in order to help treat such a person, such a patient, right? But super. Okay, so it's a device. Great. What is it?
Platform, website and applications that connect all stakeholders and track the health journey.
Super. Okay. Platform, kind of a place, a shared space for all of the people who are caring for this child to share the relevant information. Okay, great. What is it?
It's the same, both mobile application and website. For the mobile application will be as a reminder for the elderly people, and the web application will be for the, let's say, caregivers or the people who are providing the data or these things. Either could be a family member or the doctor himself, if he is following up, he takes the medicine on time, or if he need to update or add a new medicine for this patient, and all this stuff. There are many things could be done, but it's basically these two things.
Super, super. Okay, next question. All right. Now, after we've defined what it is, okay, now we can tell the user's, I'm missing an R there, user's perspective. How does it work? Not in the sense of going into all of the technology. Some of you might have intellectual property. I'll give you this document gladly. It's not, when I say how does it work, I don't mean that you're necessarily going to tell everyone everything about the intellectual property that maybe you could actually patent, right? So you always need to be considering if there's something here that you're going to want to protect in terms of intellectual property, then maybe you're not going to disclose so much information about the technology behind how it works. However, what you can help your audience understand easily, any of you who have studied any kind of engineering, if you break it down into input, magic black box, and output, even those of us who studied social science can basically wrap our brain around what are you talking about, okay? So if you can describe for us from the user's perspective, right? Whoever it is who's going to use this platform, device, machine, right? How would it work? You can give us a linear flow of step one, this needs to happen. Step 2, this needs to happen. Step 3, this needs to happen, right? And if you can really distill it down to 3, 4, 5 steps, then the audience can understand it. So take a moment and think about the process of how would this thing that you're talking about work and even if there are multiple scenarios in which it would be used, think of the classic example, right? So the classic ICU patient and the classic night blindness patient and the classic person experiencing a heart attack and the classic child who's receiving care from these multiple care providers and the classic elderly person who needs to manage something throughout their day and the classic case of a consultation between a physician referring from the community to a radiologist and the classic case of a snake bite or of somebody going on a hike. And maybe the classic case isn't somebody who's already been bitten, but rather the prevention that you were trying to promote. And the classic case of how, in contrast to someone only receiving treatment now after their infection is already quite severe, how would it work that you could detect it early before it shows up in a urine test? Okay, so think about it for a moment. What would be the steps of how would this thing work? Okay, and any of you who are thinking into the future about an innovative idea, think about it from the perspective of the user of this thing that you're developing. What would be the steps of using it?
I'm just thinking about how how does it work for me, like as a startupist or for the customer,
The customer.
for the customer.
Mm-hmm.
So you need a mobile.
Okay.
So you need to download the app.
Mm-hmm.
Okay, and you need internet.
Mm-hmm.
Okay. You need
I would say you can assume all of that.
Yeah.
Once they actually enter your app, what do? Would the classic scenario of using your app be somebody who is planning a hike to Akko and they are there already? And are you going to then, before they get a heart attack, they can be treated by the mini defibrillator? No, God forbid. So when they know that they're going to be hiking in a certain area, are you saying that the GPS system would
Exactly.
identify
That's
where
what
they
you
are,
need just to put on the app,
right?
and then depends on the GPS. If you are in this area,
The
it give
system
you
will alert you.
Yeah,
Careful, you're about to hike in an area that is known to have,
snakes, mushrooms. I don't know.
and therefore,
And then for that, you need to avoid these areas exactly, or not to eat these plants, because a lot of people they took these mushrooms in the forest and they start to eat it, and they don't know that's poisonous. And we have a lot of severe cases of that.
okay, so the alert will be in
Not
this
to eat.
area, the mushrooms are
Like a pop-up
poisonous.
message.
Okay, so refrain from eating them, don't touch them, and don't pick up rocks because there might be snakes underneath them. Have a great hike, right? That's use case 1. And use case 2 would be,
Explanation about individual, like these plants with the explanation about the poisonous and about the treatment. These snakes, how poisonous it is or not.
so
That's
the
kind-
use case, would the use case of using this information about something poisonous be somebody is hiking together with a family member and they see that somebody is starting to develop some kind of symptoms?
Yeah, this will be explanation about, I would say, prevention, guidance, and treatment, and the future to connect to the hospital.
Okay.
We receive like a kind of thing every like monthly to Kupat Kholim. All the diseases that are growing now in Israel and worldwide for tourists. We have such a thing, but not toxicology. I mean,
But epidemiology.
Yeah,
But
yeah.
business-wise, you think that all the population, like the population will buy the app, or how it will go? Like, I would never think to buy such an app. No, really, how you think, like,
That's a whole other question, the
Yeah.
monetization.
Yeah, is so for that I say, and the future will be the connecting the hospitals. So yeah, so compounded. So my customers would be also the professionals,
Doctors.
health workers.
Cool, cool. I'm trying to read everybody's body language. Are we taking a break?
Yes.
Yeah,
Let's do that. Yeah?
I need to go.
Okay,
Okay.
okay. Great,
Thank you.
pleasure. Thank you. Great. All right. I'm sorry we didn't start with your presentation. I thought we had a little more time. Okay, great. Thanks for what you're doing. All right, so let's take 10 minutes, shall we? Go grab a drink and then we'll continue. We'll work our way through the questions and then we'll start watching some of your presentation. Okay, of how to use it. Super, super, super. Okay, great.
لا
او بيتابع طول الوقت لكن تقدر يعمل شيء الكتريسيتي بس حاولت معاه بس يبدا عندك شو اسمه يدرب الاي اي اخش لي لا لا مش كله جزء كبير انا الابلكيشن هذا ما غيرتش ولا شيء لا لا انا محيت سلايد فيكم فاوندر انا هيك اسمع كم داخلين زاكي كويت كويت اسمه انا بخطط فهمت كمل شو سياسة كيف سياسة عشان شو بدك تخصص اسمك عشان كنت مسوي انا جوين الابلكيشن تبعك عندك فلوس انا عندي تركيز عمان لا لحمه ولا دجاج؟ انا لحم انا عجل سايم بتحرك عجل اصلي بس هو كان كش
انا حبيبي شكرا.
خلص انا كنت خلص السيت كيف انت شفت تكران هاي 3 مرات اه فيش هيك الشرطه الشرطه اذا بدها شيء بالملف الطبي تبعت لك استدعاء او تبعت لك امر انك تطلع شيء من التقرير الطبي مرض مش انت انا ما بطلع شيء لا لا شو فيش لا 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 انت مركزي لا 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 شو حكي خالص ولا فيش في ملف الطبي
حتى لو الضابط حكى معك قول له لو سمحت تجيب لي ورقه رسميه في الحكي هذا، انا ما بقدر اطلع شيء. الملف الطبي بتاع المريض زي حساب البنك، ما تقدرش تطلع منه كله. مش يعني انه كنا الضابط يهددك او لا، تجيب ورقه رسميه. أعطيك على سبيل المثال، أنا مريض حكيت لك عنه، ده قديش نفع طبيعي؟ ده مليون شيء، في زي هذا معلش، في تطبيق للمريض شو الحكي فاضي؟ قول له بدك تاخذ شيء من ملف المريض تجيبه ورقة رسمية وتبعتها للكوبان. الكوبان فاضي. الدكتور أشرف تعرف تبع
شو
البرزنتيشن سوي شيء؟
انا سويت
ابعت لي هذا واتساب. ظافر وين ظافر؟ الدكتور محمد وين تبعتها؟
انا عملت درافت للدرافت يعني
عشان ليك we have session with Dafna 1 hour with Dafna. Okay. Next week after 5 days it's up to them.
Whenever you want.
Yeah.
We'll do one-on-ones and I can help you sharpen your presentation specifically.
One to one. طبعا هذا الشيء تقييد يعني morning, afternoon, midnight, I don't know.
midnight of course.
midnight USA time. فعشان هيك انت يعني بتحضر عشان نكتب ان شاء الله.
Actually, thanks to ChatGPT, everything is getting
yes.
easier.
Is it?
Yes, it is.
What do you use it for?
Everything. For the proposal, for the presentation, everything. It will
Right.
like a real
بتحب تعرف
code
تتابع
idea exactly as you want.
بس اسمع.
أنا ما أعرف شيء.
What times of day tend to work for you?
One-on-one, do you meet personally or once they start?
I think we're doing.
So like if we're gonna do one-on-one, because I really want to do that too.
لا نحن زيتون شو اسمه
Because I would like to listen.
No,
Yeah.
great. I can do tomorrow at 11.
الكيبورد عندك عربي قلت لك مرة بس بغير التواريخ.
Tomorrow's Tuesday, right? Okay. Or do you prefer the day? And
أنا في جوالك.
يتلطف؟ تغذي؟
لا بالعكس عندي نقاط لا لا عادي مش دايركت
أيوة.
دكتور مسلم also فيها برضه إذا في شيء يتغير احكينا
لا مش هيك عملت
نحن هدف اليوم انه نوصل لهيك.
صور
طبعا احنا هدف الكلام هذا كله حكيم انه نوصل لهذه الشغله.
نفس كان بس عملنا برزنتيشن
يس
هذا الشيء مطلوب لا كيف هو كان بس ندخل
هلا بالبي ام سي ما تقدرش تحط صور مثلا. هل هون بدك تحط صور تحط لينكس مثلا لشيء معين فيديو 30 ثانيه 20 ثانيه 40 ثانيه مثلا صور تحكي عن عمليات او شغلات زي هيك شيء انيميتد هيك انه احرك او شغلات زي هلا في البي ام سي البي ام سي هذه اللي احنا بنسميها شغل عسكري تسليك حالي. هلا ما بده مور ديتيل هلا بدك تفاصيل بس البرزنتيشن هذا الفكره تبعتها اللي هي شرح عن كل هذا الكلام. كورس ظافر بدنا نعرض تبعتك تمام. وين دكتور اسماعيل؟ انا عندي القديمه دكتور اسماعيل. هلا عشان تعرض انت.
انا اللي اعرضه؟
انت اعرض هلا عشان ناخذ فيدباك. لا ما انت بدك تشرح عنها يعني قصدي. انت بدك تشرح. بعدين خالد عندنا هون. هاي انت وخالد.
انا خليتها زي ما هي ما عملت
more than enough more than enough. امجد وين امجد؟ امجد معنا اذا بده يعرض امجد.
جعفر موجود حبيبي.
كيفك امجد؟
الله يسعدك.
هذا كنت احكي لهم اياه
مدتها ولا ايش يعني؟ قديش بنقعد معهم؟ مينيمم ساعة. 1 hour.
You're going to have an hour to present?
No, because they want to understand about the here problem, the solution. It's not because
No, but I'm asking how long is the presentation that Lula is
with
preparing?
Rola, it's only 10 minutes, 15 minutes, and after that they will start the question. But the presentation it's maximum 10 minutes.
10 minutes.
Yeah. After that we'll talk about the questionnaire.
And are there specific criteria that you need to include?
No, for them, no. Because for them they are they want to do the market plan presentation, but the presentation with Rola, they need to understand what she is talking about, what they want to do about the solution, about the problem itself, the customers, revenue. It could be a question. But their concern is not the presentation itself. They want to understand
The idea.
what she is talking about. The presentation is here only.
Yofi. Okay, thank you. All right, let's continue and then we'll. So I want to work through a few other questions and then we're going to start with their presentations, okay? All right, amazing. So the next question. Okay, friends, a few more quick questions. A few more questions. Every time you say yeshiva, it makes me want to laugh. I think Jaffa would make a model yeshiva student. Right? You don't name yeshiva. Okay, so, all right. So friends, let's work our way through the rest of the questions because these questions can really help each of us inform what information we want to include in a presentation. And then we'll see a few examples as much time as we have until 8 to learn from our friends and be able to sharpen them. And I'm going to be working with you one-on-one on polishing your own presentations. All right, so here are some more questions to take into consideration when you're thinking about your presentation specifically for investors. So the next question is, what are the unique advantages of your solution? And this is a comparative question because sometimes you see in a presentation a comparative landscape. Sometimes it's an XY axis where you're comparing yourself to other startups in this field, and some of them are more expensive, so they're higher up on the Y axis, and some of them are more user friendly, so they're further along on the X axis, right? But I'm asking, can you summarize easily what are the unique advantages of the solution that you're proposing And of course, that's a comparative question. So without talking about the other solutions, when you've thought about it yourself, if you summarize for an investor what's going to be unique about what it is that you're proposing to do, how would you summarize, say, the three most unique things about what you're going to do, about your solution? Right? So what comes to your mind as the three most important unique characteristics of your solution? Okay,
Just about.
exactly. And cuts the time. In your case, I would start with the immediacy of provision of care, right? So in your case, it's the immediacy, it's the real time, right? That real time response, the fact that it's so portable that it's a non-issue, that it's always there, and that it's, I don't know what, simple to use, right? Okay, so what are the unique advantages? Another aspect to consider, IP, intellectual property, another aspect to consider is, can you patent this thing that you're working on? And if this idea has grown out of a university, a hospital, who owns this intellectual property, right? If you work for a university, for a hospital, maybe they own, right? If your laboratory is something that they paid for, even if it's your idea, they're probably at least partners in the thing that you're developing. So it's something to take into consideration. If this device or process, software is a little harder to protect usually, right? And the advantage of, if there is something here to be protected legally, right, is that that's a barrier to entry by some sort of competitor, right? The chance that somebody could wake up tomorrow morning and copy the exact same idea is somewhat decreased if you can protect it.
Examining the intellectual pattern.
Yeah.
Could just question
Mhm.
things in mind.
Mhm.
Could personal experience be like when we say transportation, the personal story? Could it be considered IP?
It's a good question. I don't think that.
I'm talking about services.
Right. It's a good question. Having a lot of experience in a certain field is not considered intellectual property, but it is an advantage, right? If you are trying to market yourself as a coach, as a provider of a service, right? Even if there's not something here that you can patent formally, right? If an investor wants to know, why should we invest in your app, right? Then you can say, well, actually, there's 20 years of experience and expertise behind it. It's not an intellectual property, but it's an advantage over someone who started in this field last week, right?
Yeah.
Somebody who just graduated. So you're right that it's an advantage. I don't think that it falls officially under the category of intellectual property, but it is an advantage. And maybe the place that you would speak about that advantage is on your team slide, right? If you're presenting, here's my idea, and here's how it works. And then later on you get to, and here's why we're the team to make it happen. That's where I would talk about. And the uniqueness of my expertise is what enables me to provide this service in a way that's much more professional than somebody who doesn't have this background, right? So it might belong more under the team. Great question. Okay, next question, because I want to make sure that we leave as much time as possible for your examples. So here's the thing. When we look at question number 6, when we develop something new, right? Anytime we're doing something new, by definition, there's risk involved. We can't promise that it's going to work, right? Anytime. Because otherwise it's not innovation, it's regurgitating, right? The la l'autre guerra, if we're doing the same thing again and again, and we're sure that it's going to work, right? So anytime in the case of entrepreneurship, we're trying something new, that also entails a certain risk. Maybe it'll work, maybe it won't, right? Same goes for research. So how do we decrease the risk? How do we decrease the risk when we tell somebody that we want to fund our work, right? We tell them, maybe it'll work, maybe it won't work. Are they going to invest? Probably not. How can we, without lying and without promising them something that we don't know to be true, how can we give them a sense that there is good potential here? So what is the method that we use both in entrepreneurship and in research, right? In order to gradually give our stakeholders a sense that this has good potential. What do? Research, okay? It's gradual, right? It's gradual. Just like in research, you don't start with a clinical trial including 200 patients. What do you start with?
Collecting data.
You start with collecting data, but even once you're actually doing the trials themselves, right? You start in vitro, Maybe you start in silico already in some cases, right? You start small. You start with a few samples. You start in the lab. You start with small, we start with mice, right? You start with small, now it seems not here, so we can't keep referring to as mice and the snakes. What?
With a molecule, we start.
With?
With a molecule, we start.
With a molecule. There you go. Okay, we start small. So my question about what proof do we have that it works, the more evolved your project is, the more proof you will have of, I've already done this, so now I know that at this scale, it already works, right? I know that at lab scale, under these conditions, it works. So what we're telling an investor is, I already have a working prototype. I already have a working minimal viable product, right? If you've heard the term MVP, minimal viable product. Now, so usually, and it can also be a question of what has already been shown in the literature to work in these cases, right? If it's already been shown, if you're going to develop, for example, a new device that doesn't yet exist, but it's already been shown in the literature that certain manipulations can prevent deep vein thrombosis in immobile patients in an ICU, right? Then that kind of literature is proof that this kind of device could be effective, right, in preventing DVT in immobile ICU patients, right? So that kind of proof. All right. So you can each think about, I'm just going to run through the other questions and you guys can write them down and I'll also send you this page care of Jaffa and you can answer these questions patiently for yourselves. I warmly recommend thinking about all of them. I'll show you as we watch our friends' presentations how these questions that I asked appear as answers, as messages in the presentation. All right. So that's now that we understand about what the problem is and what the solution is, then the second part of a presentation is the financial part of it. Okay. Now, with regard to the financial part of it, anytime you are talking about a for-profit endeavor, okay, you want to be sure that it's very clear to the investor what market are we even talking about. Okay. How would can any of you define for me in a word or two, what market do you operate in? And I don't mean operate like in your case. What kind of, there's only one of us in this room who actually operate.
Hospitals and rehabilitation centers.
There we go. Okay. So maybe it's the ICU in, is it ICU in hospitals and in rehabilitation centers? Okay. So there's the market. All right. So maybe there is a number in billions of dollars annually, right? It could be globally, it could be in the United States, it could be in the EU, it could be in the Middle East. You need to define what market are you talking about, right? And very often in the case of Israel, very often what we do is we do a pilot project here. And after we establish that it works, then we scale it up because usually we don't develop a product, a device, right, just for a 10 million person strong market, right? So usually this is a use case that we try it out and we establish it and then we scale it for the US market, for the EU market, for the Far East market, for the Middle East market. Okay, so you want to define what market you're operating in, how big it is now. So you want data, right, of how big the market it is and what the growth rate, the growth projection of this market is. And anytime you're talking about a for-profit scenario, it needs to be very clear. And here's where the insurers that we spoke about before might be involved, right? In the case of malpractice suits or whatever, who would be willing to pay whom in order to have this issue addressed? Okay. So the business model could be, usually it's either business to business or business to customer. I think that most of you are talking about ideas that are business to business. Okay. Almost all of you. I don't think I've heard an example in this room today, right? That any of them are actually for the general consumer, unless maybe a coaching app. Maybe a coaching app could be direct to consumer. Sometimes it's B2B2C, business to business. Maybe you would be selling this defibrillator watch to suppliers or or distributors of medical equipment, and they would then sell it to individual, exactly, nurse organizations or first responder organizations or volunteers at first responder organizations. All right. So the business model is usually we don't need to invent the business model. Usually we need to just show that we are using the logical business model for the type of product or service that we're talking about. So are you selling a device? Are you selling hardware plus software? If it's a software, if it's an app or a program, it's probably going to be a subscription model, right? of the software. If it's a device, maybe there's also maintenance involved, right? Okay, so there's the business model. So then after the business part, the last three items that I would warmly recommend including towards the end of your presentation, and now we'll see a few examples, are team. The last three slides that I recommend including in a brief 5-minute presentation are the team, the timeline that shows where are you in the evolution of your idea. Because when we say early stage startup, it could be, I have an idea that I wrote on a napkin in a coffee shop when I was speaking to my friend. That's one end of early entrepreneurship. That's where it starts, right? It's also early stage startup when you already have your first pilot project with your first customer, right? That's also early stage. So are you at this stage of early stage? Are you at this stage of early stage? Or are you somewhere in the middle? That's why I recommend, so team, timeline, and call to action. I'll briefly touch on each of them and we'll start looking at your examples. With regard to team, what investors are particularly interested in hearing, and it's a criteria for them of whether to invest in your startup or not, is not just, is this a great idea, but also, are you the specific team? And very often it's not only a single founder, very often it's a synergy between a few founders who have complementary to one another skill sets. So maybe one of you is the doctor who brings the medical expertise, and maybe your co-founder is a person with experience in the business side of things. Maybe one of you is a software developer, and the other one is the person with the clinical insights, right? So about the team, it's usually, here is what makes us the right combination of skill sets in our founding team that can deliver successfully this product or service from idea to market. Okay, so that's what I would talk about at that point. Okay, so what is it about the combination between you and your co-founders, if you have co-founders, or what is it about your background, if so far you're a solopreneur, that makes you the right person to be able to develop this thing? All right. Second to the last topic that I would address in a 5-minute brief presentation is a timeline. I would actually draw a horizontal timeline, okay? And I would write 3 to 5 main points on it, recent past, current, and near future, okay? The point being, you're now communicating to this potential stakeholder, such as an investor, where are you in the evolution of your idea? What have you already done? What are the most impressive, significant achievements that you have already done? Do you already have a working prototype? Have you already tested something? Have you already interviewed 100 potential customers and you validated your idea with those who would use it, right? So depending on your specific field and how far along your journey you are, on this timeline, I would actually show, so where are we in the process? After establishing this company in Q1 of 2024, we've already done this, and this, right? Now we have a working prototype. And so the next step is that we're looking to establish a pilot project with our first early stage user, right? Which is a rehabilitative hospital. All right. Which leads us directly to, okay, any of you who have been at previous workshops of mine know that it breaks my heart when the final slide of a presentation is what? Those of you who have not yet been at a workshop of mine, think of yourselves in the audience of basically any presentation you've ever experienced. What does it say on the last slide? Thank you, with a little gif of clapping hands, right? Or what else? Questions with a little smiley with question marks coming out of their head, right? Okay, maybe it's polite, but what else is it? Wasted real estate. Wasted real estate. The final slide of a presentation is prime real estate, not in a cynical way at all. It's a great opportunity to invite the audience to do something. They're there for a purpose. You're presenting to them for a purpose. I beg each of you, okay, to always use your final slide of a presentation to any strategic audience in order to invite them to do something very specific. The more specific it is, and the more interested they are in collaborating with you, and the more easy you make it for them to take a step, more chance that they will. And even if they don't end up taking the step, it's still worthwhile for both sides when you're very specific, even if it leads them to go, huh, cool idea, not for me, but cool idea. Why is that beneficial also? Even if they don't end up investing in your startup. Okay, they could connect you with somebody else that it is relevant to them. They could note to themselves, "Oh, wow, very strong entrepreneur, very cool idea. Not for me right now, but I want to follow up with them in a couple months and see how it's going. This is still early stage. I need more validation. I usually invest in round A, not in pre-seed, but I'm going to get back to them on it because they're on to something big here." Okay. So either they could refer you to somebody else, or they could get back to you about it later on, or even if it turns out that absolutely it's not for them, that's also good to know because then you know politely you made a good impression on them. They're not the right one for you. You're not going to waste more time on trying to court them and have a relationship with them because they're not interested. Fine, move on. Okay. So clarity and specificity is very mutually beneficial to everybody involved. All right. So the final slide that I would include in a presentation, even a brief 5-minute one, would be an explicit call to action. Now that call to action is an invitation to this particular audience. What now? If it's an investor, the typical what now on behalf of a startup is we are currently raising a pre-seed or seed round of X amount of money with which we are going to do 1, 2, and 3. We're going to purchase the something. We're going to develop the next stage of something. We're going to hire a somebody to do this. We're going to go test out this over there. Okay. So if you're as passionate as we are about addressing this issue, join us. That's a call to action. I'll take your question in a second, Lana. So that's the call to action by default of a startup to an investor. However, you're not only presenting to investors. What's a default call to action if it's actually potential customers in your audience? What are you inviting them to do? They're not going to invest. What are they going to do?
Something like this.
Try it. Okay. So it could be get in touch. It could be some sort of get in touch. It could be download the demo. It could be coordinated time. It could be coordinated time for us to try it. What? A questionnaire. It could be here, you can fill this out and we'll get back to you about how we can customize the service to you, right? What I'm saying is you always want to customize your call to action depending on who the audience is. And there is an appropriate call to action for any target audience. Even if you're a lecturer at the medical school and you present to students, the call to action could be for next week. Please read, please put into ChatGPT this book, so that it then gives you the answers to the question, what does my professor actually want me to know? So there's always a call to action. The call to action could potentially be if you're looking for collaborations, right? The more specifically you define what you're offering, the more easy it is for whoever's in the audience, if they're interested or if they know somebody interested, to get back to you about it. Okay? I'm going to send you this page through Jaffa. I recommend to all of you when you're starting to work on a presentation, answer these questions well for yourselves. And now we'll see in the few presentations that we'll watch now of our friends, we'll see how great. We'll start with Dr. Ismail. So we'll see how the answers to these questions are expressed in the messages that are featured in the presentation. Lila, what was your question? Okay, Lila, what was your question, dear? Tell me. Two separate things. If the conclusion is that you're trying to remind the audience of the main points that they just heard about, then I would first remind them of the main points. For example, let's say you're pitching your startup to investors and you say something like, so in conclusion, right? By using this system, we will all improve the quality of the water and the air in our community by decreasing significantly the amount of pollution. So that's the summary of it, right? And then the call to action could be, I'm currently raising a round of 500,000 shekel in order to now test out, creating these unique collection centers. So you could first summarize and then you can invite them to do something specific.
Thank you.
Okay, thank you. All right, Dr. Ismail, cure us.
Hello, everybody. My name, again, you know my name. My name is Ismail Musallam. I am a retina specialist for around 40 years, and I'm interested in retinal disorders especially those without treatment. And I'm keen to develop treatment for these disorders that left without treatment, and they are in millions actually, these regions. If we are speaking about the retina is the back of the eye, which is the more sensitive part of the eye that transfer the visual stimuli into electrical stimuli to go to the brain and being translated into vision. So this is the core business for myself is the retina and its disorders. Whenever we are discussing a problem, we need to look at the needs for that problem, whether there is real need or not. And when we are looking for the retinal disorders, we can categorize them into two categories. One is treatable conditions, but with limited success, like diabetic macular edema and age-related macular degeneration. And these treatments are currently being treated, these conditions, by repeated injections with scenarios of complications, and the outcome of these injections really not rewarding, not great, at least in my opinion, after thousands of injections that I gave to these patients. The other category of patients, which can be considered as non-treatable, there is no treatment for these conditions. And these include retinitis pigmentosa, achromatopsia, and other inherited retinal disorders. In addition to central retinal artery occlusion, which is considered as stroke. And this means that, if we can find treatment for this condition, because it is as part of the brain, we can treat stroke for the brain. So this is the most important part regarding this treatment. Now we would like to focus into small part of my work, because I'm worked on all these categories, but I have to shine light on retinitis pigmentosa and the use of ocular neuromodulation as a new modality of treatment to this untreatable condition. What's retinitis pigmentosa? Retinitis pigmentosa is inherited retinal disorders with night blindness. The disease was started with night blindness, and then the vision at daytime being affected with constricted visual field, and at the age of 40, most of these patients get blind. So this is a blinding disease, and without a treatment. I will explain what it means by without treatment. The only treatment for these diseases is gene therapy, which targeting one category of patient with mutation RPE65, and the cost of treatment per patient around $1 million. So this is the issue, and with limitations, with complications, and invasive technique and other things. I don't like to go it. I will discuss it later. So what's the philosophy behind ocular neuromodulation? When I looked at this disease for years and years, I'm always looking at a retina with attenuated blood vessels, with reduced blood flow. And I said, okay, and so this means that it's vascular disease rather than, any other disease. It's okay, it's genetic disorders, but the vascular phenomena is very clear. And some researchers since long time looked at the disease even at the earlier stage, before the clinical feature of the disease appears, and they found that the blood flow reduced in these disorders. And this raises up, this causes this reduced blood flow, causing all the cascades of inflammation, oxidative stress, and degeneration of cones and rods, and degeneration of the retina as a whole. So, in brief, the cascade goes from reduced blood flow, the photoreceptor gets starvated, without these sufficient glucose and blood, and goes into dormancy state. The dormancy that the cell stay alive, but losing some of its parts and not functioning. And this means that if we restore the environment back to normal, then these cells can be able to reform the missing part and function again. This is the principle that reactivate dormant cells by recreating new environment that is good enough for these cells to regrow their missing part. So many surgeons and eye surgeons thinking of increasing blood flow to the retina, but they're using drugs by vasodilating. However, the problem with vasodilators is that dilate all the blood vessels of the body, and the effect on the eye will be very minimal and very small, in addition to the side effects of systemic side effect of vasodilators. Then we asked another question: could we increase blood flow, in particular to the eye, without causing blood flow to increase to other parts of the body? And the answer coming from this. The ophthalmic nerve supplying the blood vessels of the eye and again to the brain as well. And if we stimulate this nerve, it can cause different mechanisms by which the blood flow can be increased, whether by trigeminal vascular activation or parasympathetic stimulation or axonal reflex. So this means that we can use a non-invasive modality to stimulate the ophthalmic nerve in order to get the effect that we need. It's the increased blood flow and reverse the cascade of the disease. So the solution, what our solution? We hypothesize that the problem is reduced blood flow. Then we have to work in a way to increase blood flow by our mechanism. And we use ophthalmic nerve to stimulate, non-invasively stimulating ophthalmic nerve, which is distributed in this area, in order to increase blood flow. And we use mechanical stimulation and chemical stimulation, because most of the neuromodulation devices using electrical stimulation, which is faulty. I don't like it. Why? Because it is non-selective, non-specific to the nerves. If you stimulate electrically here, it can stimulate sympathetic, parasympathetic, sensory nerves. However, if you select this mechanically and chemically and target specific nerve fibers of the ophthalmic nerve, which I'm interested in, then we have to use what we call mechanical stimulation, that to stimulate the mechanosensitive nerve fibers in order to produce specific mediators that will produce the effect, which is increased blood flow. So this is our main principle. Additionally, we use ascorbic acid, and we will discuss it later on, as potentiating agent, because all neuromodulations using just electrical stimulation without potentiating agents. What's the effect of potentiation here? Is that we produce by mechanical stimulation liberation of substance P, which is vasodilating agent. And we catch this and prevent its degradation by ascorbic acid. Let's say ascorbic acid prevent degradation of this substance quickly. So this means that we are potentiating the pharmacological effect of liberated endogenous substance P. So we are just, letting the physiology works rather than interfering by different ways. So I'm glad to say that we published this very recently in very, very reputable journal. It's an international journal of vitreous. There are 2 journals in retina worldwide. This is the second one, which is international journal. And indeed, we are glad again. Just 2 days ago, I've been invited as a speaker, international speaker, in a big conference in Dubai, in order to explain, because they hear about this new treatment and they said, "Oh, Ismail, come and speak to us. What we are doing." So this is now. Let us do what's this? This means that we are giving stimulation for a couple of weeks, non-invasive, convenient method. The patient sitting in a relaxing chair. We give the stimulation for 1 hour, and then we look to the results. Very surprising. 60% of our patients restore their night vision. They are blind night vision. They couldn't move at this time of the day. They couldn't move. They just catch somebody. They need help of somebody. This patient can move frequently and easily. Even kids can go and play football you know, أولادنا بيلعبوا فوتبول في الليل at night and enjoying their life. And the ladies never go up with their husbands, you know, after this time because they are ashamed that to say they want to catch their, you know, and these ladies used to go and enjoy night vision like any other.
And they're playing football now too?
So, yeah. So,
Go shopping.
so what is the remarkable thing that we find that we restore vision? Whenever you implement this treatment at earlier stage, you get a higher success rate and you get the outcome of it much better. Not only this treatment can increase, improve improve the night vision, but also improve day vision, which is called bit corrected visual acuity, and contrast sensitivity. Okay. So let us see who are the competitor with us. The competitor, there are two main categories of treatment that are available in the market, no other treatment. The first one, which is Spark, which giving it's producing Luxona therapy. And Luxona therapy, what are the background, the limitation of this? One is limited application because being given to 1% of the population of retinitis pigmentosa, because you have to look and find the mutation. If there is no mutation, you couldn't give the treatment. Two, very invasive, is very horrible operation. You need to do very invasive procedure and inject the gene underneath the retina. Additionally, complicated. Three, sophisticated, and you need a setup that is available maybe in a few countries worldwide. And you need training for staff. All this hassle just to give a treatment which is very expensive as well. It costs around $1 million for each patient. So you know how many, you're asking how many patients can afford this? Very few. Okay. The other one is electrical stimulation, again by electricity, which I do believe that is not effective because non-specific. And the maximum outcome of this treatment is to prevent or delay deterioration of vision, but there is no real improvement of vision. So this is what we do here. You know, our treatment has many advantages over all these. One is non-invasive. Two, it is for a couple of weeks. Three, cheap. Three, four can be given at, you know, I can give it treatment to anybody sitting just right now by my mobile device. And four, it is affordable and can treat patient at different stages of the disease. That's say you can give it as prophylactic treatment if you detect the disease as early before clinical manifestation, and you can use even in the advanced stage of the disease. So that's the slide. For ocular neuromodulation, you can give it at the preclinical, at early rod degeneration phase, at the cone degeneration phase, and cone degeneration phase. If you look at the gene therapy, will be given at early stage. And if you go for retinal prosthesis, which is really terrible device, you will give it, you wait for the patient to get till the patient getting blind, and you said, okay, now we can give you the treatment. So our invention is patented. We have two USA patent as well as one Israeli patent for this treatment. Second, what we need at the moment, we need collaboration. We need somebody just to share with us this effort in order to go ahead and finalize this product, which is highly needed because there is no treatment so ever apart from what we are explaining. Looking at the market size, it's billions of dollars, around $15 billion just for retinitis pigmentosa. And we'll reach to projected to $21 billion to 2033. It's business model, B2B to C business model. That's what was our model. What we are going for, we know that we finish a clinical trial early clinical trial. We need to go for production of prototype. This is the next stage. In order to go for multinational, multi-center studies, in order to get the FDA. So this is our what we are going to do, and these phases need to around $600,000 for clinical studies need $1.2 million, and for the manufacturing we need around $500,000. So again, this is my belief on the treatment. We are not in need for these big hospitals. We need a leisure place with neuromoduration there. And the patient will come and he's just enjoying this, taking he's appointed, have appointment for 1 hour, will take his treatment and then go and play his game or enjoy his business meeting, or completing his work, because it will not interfere with his normal life. Even he get more active and more relaxed after the session. So I mean, imagine that, you have what you call it, something clinic, very modern clinic. You have it somewhere. You go in. You know that you have your seat there. You will get your session, finish your session, and go immediately, leaving your place. Leaving you the place that you receive treatment back to your normal activity, because not injection, no pain, even the treatment improve your morale, your psychology, because affecting the parasympathetic system make you feel happier. So yeah, exactly. So I would like to thank you for attention.
Wow.
Yeah.
Wow. All right. Thank you so much. All right. So we'll work one-on-one on specifics, but I want to generalize. I want to offer all of you some insights of things that we can learn from what we just saw from Dr. Eastman's presentation. Okay. So some suggestions that I have for everyone. I would recommend that when we are presenting to audiences, when we're working on such presentations, I recommend having two separate versions of the presentation. Okay. One presentation is to present, and in the to present version, I recommend that it has much less text on it than what we just saw. I think this much text is actually really good for a version that we send someone, that we share after having presented, in case, say, the investor wants to share it with other partners in the venture capital fund, right? Also with partners who didn't attend the session in which you were presenting it. And then if there's just a title and a bit of visuals, that's not enough information for them to share internally. So one thing is on the slides that we share, that we present to the audience, I recommend minimizing the amount of text that we have on it so that the audience is not busy reading, but rather are cognitively available to listen to your explanation. A second point regarding the content is we really need to carefully consider what is the level of disciplinary understanding of the audience. Dr. Ismail must hold investors in the highest medical regard, because it seems to me that only investors that have gone to medical school would be able to follow some of that explanation. Okay, there's a lot of very discipline specific, and maybe your fellow colleagues who are also physicians, even if they're not ophthalmologists, can follow the logic because there's a lot of medical terminology. But for investors, a lot of the data that appears on these slides are way too deep in terms of medical information for the investor to be able to follow the logic of it. Okay, so you'll want a simplified version that kind of translates the significance of the medical information into the business use case. This means that it costs this much to treat it. This means that it takes this much time to recover from it, those kinds of things. Okay. Some of the slides have multiple messages on them. I would actually recommend single message slides. Usually the audience doesn't care how many slides there are in a presentation, they know how much time there is. If it's a 5-minute pitch, a 10-minute pitch, a half-hour meeting that you're starting by presenting for 5 minutes and then 25 minutes of discussion, right? So if there are multiple topics on one slide, I would actually recommend separating them into a succession of slides that each one of them has a single message. And then opposite a single message, you can have the discussion. I would also recommend to connect in your spoken narrative to connect between subtopics in a way that enables the audience to follow the logic. So you could say things instead of things like, now let's talk about, right? You could ask a rhetorical question. So how do we address it? Or what's unique about our approach, right? With rhetorical questions, you can connect between the multiple subtopics, and then the audience can follow the logic with you. And I would be even more specific when you get to the call to action for collaboration. Is the call to action for collaboration a request for funding? Or are there other types of collaboration that you're looking for? If it's other things in addition to funding, I would actually say specifically, are you looking for medical centers that would be interested in having a trial using your, are you looking for other ophthalmological clinics that are forward thinking and would be interested in trying to replicate that experiment that you did?
No, I need, in the slide, I said that we need two things. One, prototype, and later on, multi-center study.
Okay,
What we need investors in order to produce the prototype.
So it is
and then
investors.
to go to the multi-center study.
super. Okay, so maybe in some cases you'll actually want to be specific
Yeah.
about how much funding you're raising.
Yeah.
Amazing. All right, thank you so much. Super.
Thank you very much.
Great. So we'll work on details. And thank you so much for what you're doing. Great. Who will we learn from now?
Daf.
Stefan, thank you.
My pleasure. I would like to say something before.
Please.
It's very important to whom we are addressing.
Exactly.
So this
Exactly.
presentation I made very fast, and the target audience was Yeshiva, because I had a meeting with the professor there, and they are giving a course which is titled Communication Marketing. So
Amazing.
that's why I made this, just to give her an idea about my presentation. So I did it fast.
Excellent.
So that's why it be different from what we are talking, if we are to investors or
Super.
something
So
else.
this is
So
not
that's
for
why-
investors.
No,
So who are the participants in the Yeshiva program?
Yeah.
These are fellow entrepreneurship
Actually, it
students
was-
or?
yeah, actually it was online meeting with the professor there, and I wanted to make this presentation in order to tell her about my idea, in order to go further.
In the
that she can
program.
Understand what I am talking about,
Excellent.
and then explain this to her
Excellent.
students.
Zaffar's point is actually very, very important. Before any presentation, we always want to ask ourselves, even before the questions that I presented to you at the beginning of the session, the two most important questions to ask yourself in advance of any presentation so that you can customize accordingly is who is it for and what is it for,
Yeah.
right? So Zaffar's 100% right that you want to be sure that you know per scenario who will be my target audience in this event, at this presentation, in person or online. Are they investors? Are they colleagues? Is it a medical center? Are they medical professionals? Do they have a medical education? Not necessarily. And the second question, in addition to who is going to be sat there so that I can adjust the level and the content accordingly, is why are we meeting? Why am I presenting to them? Are they looking to found partnerships? Am I looking to get accepted into a program? And this is my application process. Are these investors and I'm looking to get funding from them? Is this a networking session and I'm looking to meet other people who might be interested in collaborating with me? Excellent point. So we always want to be sure who is it for and what is it for so that we can tailor make our presentation accordingly. Beautiful. Okay, so now we know that this was a presentation in which you were presenting your project to the friends and the collaborators from Yeshiva University in order to further the collaboration between you and them within the program. Great,
Yes.
great.
So I will simulate that I'm doing this in front of investors.
Excellent.
Okay, first of all, thank you for your time and for giving me the chance to present my idea in front of you. My name, my application name is Coronex. This is just a name. and it's a smart health and time management application. And the idea of this is empowering elderly and diet-dependent individuals with reliable health reminders and monitoring. And I did it. I'm the founder of this, as you see. Uh, the problem that I'm dealing with, or I am going to solve, first of all, missed medications and diet, serious health risks, because people who are missing these medication will be in a serious health risks. Also, caregivers lack real-time visibility because many caregivers are not on time or following up the, let's say, the medications that their elderly people taking. So it's adherence based, and also existing apps rely on smartphones and not elderly friendly because many of the old people are not, let's say, interested or happy with using the smartphones. Also, no integration of vitals, diet, and safety in one system because my idea or my system will be following these things, but others are not always following these, or other applications, let's say, not following these vitals or diet and safety in one system. So I'm trying to integrate all these things in one system at the same time. Also, the solution of Chronics is a bracelet and an application at the same time. So it will be a smart bracelet with beeps, vibrations, or sound that gives, let's say, reminders for all those elderly people. And it will be also offline. That means that I will not rely on online connection. It could be offline connection. And whenever we have, again, online connection, it will be updated and connected immediately. Health monitoring, it will be also monitoring many vital, let's say, things like heart rates, SPOs, which is the oxygen in the blood, temperature and fall detection, because temperature could be measured also by the hand, not only with the fingers like what we see or what we may test or, let's say, examine at the clinics or in hospitals. And there were also, for instance, today I saw a study about this and proves that temperature in the hand gives good and more pure indications about the system. Caregivers dashboard, real-time alerts and adherence reports. That's what I said, because it's very important to follow up the case or the, let's say, the health of elderly people. Also, it's a simple design, one button, voice enabled or minimal setup. It's very important to point this out because most, or let's say, I'm not comparing with other applications or smart watches or whatever, but what I notice and what I find out during my research, that it's very important to focus on the easiest way for elderly people. That's why I'm focusing on this thing in my solution. And also work offline, sync when it's online. So when it's in online, it retrieves all the data and gives everything to the, let's say, caregivers or the, besides what kind of caregivers, maybe it's the family itself, maybe it's the doctor, maybe it's the hospital, maybe other, let's say, interested parts. Competitive advantages in my solution, in my application, works without a smartphone, independent and wearable. Also, it's elderly friendly, simple, tactile, and not tech barriers. There's no barrier communication or technical barriers. Always, I'm focusing on the simplest way, and also integrated solution, medication, diet, vital safety. All these things will be in one application. I mean, medication as a reminders for all elderly people, diets, as I said at the beginning, also vitals and safety, because if someone falls, there will be a GPS follow up, so or control. So whenever there's someone is falling, there will be follow up or let's say very urgent interventions to help those elderly people. And also all these vitals that is my application or my bracelet is measuring all the time will give let's say, a surveillance or let's say a follow-up for the elderly people, besides what kind of health situation that they have, and that will help for let's say their secure and for their safety and health as well. Also, real-time caregivers and doctors involvement. All what I said in this point is leads to this part, because always there will be an involvement, sorry, of doctors or caregivers besides what they are. And privacy and encryption as a core principle. This is very important in all kind of softwares and applications, and so I take care of this, and to be totally encrypted, because this data is very important. Only caregivers or people who are in relation, let's say, or like doctors who has the accessibility to this data, because they can know what kind of problems or serious problems that they are facing. Target market and growth potential, as I know, or I find out, sorry. The primary users who are elderly, I'm talking about 65 plus, and chronic patients, people on structured diets, and caregivers. There are also secondary users like nursing homes, wellness companies, insurance providers, and also there's a growth potential about aging population, chronic illnesses. Well, that means urgent global need, expansion via hospitals, pharmacies, and insurers, and it will be business to business model I'm talking about. This was for them, for that, Professor, what I said, that goals and support needed. So it will be also the last, as you said, the last three slides who are talking to, and what's the last goal. I was asking about objectives in pre-acceleration, validate idea with mentors and experts, refine business models and go-to-market strategy, build marketing, branding, and social media strategy, and network with healthcare and tech partners, and prepare investors ready pitch. That's it. Thank you so much.
Right, to University. Thank you so much. That felt lovely, lovely, lovely. All right. So here are some general suggestions that I have for everyone of what we can learn from Zafar's presentation. So back to the first point that he gave us all, which was very important, that we always want to tailor our presentation to the specific target audience. And so obviously, if Zafar was making this same presentation to a different audience that wasn't the members of the committee at the Yeshiva University program, he would change the content. He would change the content. He would change the approach. He would change the focal point. So this was very much tailored to that particular audience. Great choice. Okay. We saw an interesting use of a technique here. When we have multiple bullet points, I absolutely encourage using the reveal, the gradual reveal that Zafar was using. If you have 4 or 5 different items on a list, I find that it's absolutely more helpful to the audience if you reveal them gradually, one by one, at the pace of your explanation, because if as soon as the slide appears, all 6 bullet points are already on the slide, what does the audience do? I'm sorry. No, we're sorry that we missed your. We're sorry we can't send you the private helicopter. Thank you so much for coming. We really appreciate it. And thanks for what you're working on. We're all investing in your startup. Be well, safe travels. Okay. So when there is gradual reveal of the bullet points, that helps the audience focus. Oh, now we're looking at the first point. And then depending on which audience it is and how much time you have to give the details, then you decide when are we ready to see the second bullet point. So great choice there also. Okay. I would actually start with the problem for other audiences. If you were actually going to present this to an investor, and this was not for investors, but I'm showing you options. If you're going to make a version of this presentation that is geared towards investors, I would go straight with starting from the problem. Without background, without explanation, I would start right away for a different audience. I would start right away with, here's the problem, right? There are people, lots of people, elderly, who suffer with chronic diseases, with needing to change all kinds of, or keep to adhere to a strict diet, and they are currently challenged very often in carefully adhering to the recommendations that they received from their physicians and caretakers. Okay, so I would structure it a little bit differently. I would start with the problem. I would go from there to here's what they're currently attempting to use as a solution, and here's why it's not working. That's why here's what I propose as a solution. What I'm not sure I understood about the concept of your solution, I felt like there was something a bit contradictory when you were saying that it's a bracelet plus an app, right? But then you're saying there's no need to use a smartphone. So where's the app if it's not on a smartphone?
No, it's an application on a smartphone, but what I meant, because usually when we use smartphone, okay, apart of it's charged and that's it, it should be connected to internet or to be online.
use it offline.
So, but in my solution, I don't rely on internet.
Oh, okay.
Internet.
So it's
It
not
would be
dependent.
another solution that I can rely on this application without relying on internet access.
Cool.
Because most of the applications, or usually what is tend to use, is online services. So in this solution, it will be not on.
So maybe depending on how much you want to share of the technology, maybe you want to mention at some point what sensors are included in this bracelet so that it makes sense how it is that
Yeah,
it
that's why I didn't go wide, as I told you, because it was not for.
It wasn't for that audience.
but in
Wasn't for that audience.
This
Great.
region, let's say, or this place, I
Right.
would something else.
Right,
With,
right, right.
more.
Right, and then another question that occurred to me when you started getting into the very important issue of privacy, right, and of encryption and everything, was the audience that you were thinking about when you think about the audience that's elderly, were you thinking predominantly of elderly who are not independent and need the help of others, and therefore that either with some kind of cognitive decline or they're not necessarily aware of their situation? It almost felt to me like you were saying that the caregivers and their family members and the others surrounding them are the ones, would they receive the information or would the person themselves receive the information?
No, elderly people are not, as I said, not technology friendly people. They just, and they always get bored very fast of all these things. Even if they book an appointment at the clinic, they want someone to do it for them. And if they go and wait, they will get angry. Because I noticed this. I have been in different situations and I noticed it and I study it. I observe it.
Got it.
So in this case, what's very important is for caregivers to follow up all these steps. What's important for the elderly? Just to have a reminder that you have a medicine now, take it and that's it. But if they didn't follow up, the adherence will be something else because there are other people who are following up.
Got
And
it.
also in Israel and in other countries, there are many elderly people who are
Right.
living alone or far away of their, let's say, sons or siblings or something else. And also what I noticed that there are many elderly people who are having a maid with them. So sometimes this maid is not quite enough educated or taking care of this. It's just a job. If he forget one pill, okay. But if this application works well, everything will be on time. And that will help also the doctors to follow up.
Got it. Okay, great, great, great. So we'll work on it on the one-on-one. Thank you very much for this great idea. All right. Super. Thank you. All right. So now we are going to learn about from Khalid about
My first time present.
we're excited. We're honored.
Okay. Livability is the name of our startup. The main problem here is lack of continuous communication between caregivers, like doctors, therapists, and schools for children with disabilities. Every children where doctor tell his parents this they have a disability, take a report, make an appointment for therapist. After 1 year, take this appointment, take another report, go to his school, have another therapist or another caregivers for him, they take another report. They make a box file when they want to Aline Hospital, for example. They take a box file from report from every one. When they want to change school or go from 6 years to another school, secondary or something like that, also take their reports to another school. This is what happened here. The second problem we have is difficulty tracking therapy progress and identifying effective interventions. As I took the previous, everyone take all the reports, and that make a lack of tracking, because when he go to another school or to another therapist, that will make confusion where he at what milestone or what he did, what can do and what can't do, and how fast he make this milestones. Fragment data management for individuals' records, and insufficient personalization of care and therapy plans. The solutions we have is connect family therapists and educators, tracks and analyze therapy and learning progress, integrates AI to recommended personalized interventions. How we will do that? By make profile for every child, contain all the reports he have, and progress tracker. Okay, it's not the real time, this need update. Progress tracker, see all the reports he have, and put a clear vision for everyone want to communicate with this child or to give them any kind of support or caregiver. And we want to AI integration. The reports we have, most of it, 12 pages, 13 pages, from the therapist, from the doctor, from the other. Every time want to read this report, this will take time. And when the parents wait a lot of time because to go to this appointment, and this take 30 minutes, 15 or 20 minutes from this time take to read this report, this will make less time for support this child. We will make a summarize for the reports, and the AI will help us to see where is the child, what standing, yes. Okay. Market opportunity. We have over 1 billion people worldwide have a disability. Okay, this is statistics at Israel, United States, and Saudi Arabia and Gulf region. We see that
1 billion have disabilities.
Yes.
Wow, wow. One out of 6 billion.
Yeah.
7
We have some percentage. It's not يعني مش كتير متقاربة على بعض. We have here 15, 13. At United States, we have 1 in 4 adults, like 25%. Because every country have their
Own statistics.
yes.
Even definition of disability may be different.
But you're talking specifically about children, right? And this number includes
Now,
adults.
yeah.
And your
Now,
app is
yeah.
for children.
we can expand our idea to take everyone.
Okay.
Okay. Because we have I don't update everything because we have sessions for the children now. When therapy want a practice something for child like speech or physiotherapy, something like that, we want to take uh, sessions or videos for children to do at home. Okay.
Mhm.
Okay, this is the market size. I tell like 1 billion people worldwide with disabilities.
Okay, so it's a huge market.
Yeah.
Mhm.
And here some competitors not contain all what I prevent at solutions,
Mhm.
but there's something like for therapists, something for learning, something for health data tracking, but not making a profile for everyone and not making our advantages. Our business model is B2B. We want to make a subscription-based plans for institutions and making licensing of AI analytics tools to healthcare and education providers, and optional premium features such as detailed reporting and predictive analytics.
Mhm.
This is our timeline. Our MVP in 2 or 3 weeks will be complete.
Congratulations, exciting.
Yes. And we are looking for phase 2 to run a pilot program with schools. We will begin with schools and therapists. Phase 3 expand service based on feedback and refine platform feature. Phase 4 is launch the eligibility platform and scale the platform to Saudi Arabia and US and other global markets. Our ask is $50,000 to complete our MPP, launch pilot and user testing and iteration, branding and early marketing.
Yay! Thank you, Khaled. Very exciting. Oh wait, I'm sorry.
Yes, this is our team. Me, Khaled, and my partner Muhammad Asi, and Raed Kutene is our advisor. He's a physiotherapy.
Super. Thank you. All right. So a few words because we want to make sure that we have time for another presentation or two. So a few suggestions. That was very exciting as a first presentation. Good for you. You did it. So I would actually start talking about the problem through an example. I would choose a story, especially if you're inspired to do this work because you actually know personally of cases. So even if you're not comfortable talking about a personal case, you can give an example from the media. You can give an example. You don't even need to say the name of the person, but you can describe a specific scenario. And then instead of it being bullet points, you could say something like, when 5-year-old Muhammad, who was facing, this disability, wanted to, when his parents brought him to see on Monday a physiotherapist, on Tuesday a speech pathologist, on, the following week, if you give us an actual example of a real person and how the lack of coordination between the different caregivers resulted in some sort of suboptimal care, right? Then immediately we understand, oh, seriously, really? That's how it works right now? There's no coordination? Does that mean that he received double of something and was missing something else? And the teachers at school didn't know about something that if they had known about it, they would have been able to provide much better care for him. So any of you who are developing a platform that actually serves people, right? If you can start by giving a real example of how the current scenario results in the people receiving less good care. So I can already imagine if there's a person in the ICU and they ended up having deep vein thrombosis as a result of not receiving enough physiotherapy, then that immediately makes us think seriously, we could have prevented it. And that's exactly why creating a machine that will enable, so same idea. For any of you that can provide a before your solution versus an after your solution scenario, it makes it really clear to the audience, oh, here's what reality looks like in a world that doesn't yet have your solution, right? And we hear a story, a real one, not an imaginary one, absolutely use a truthful, real use case, right? And then we're all full of empathy because we're like, seriously, in 2025, we could definitely do better than the way this is currently happening. And then you can compare for us. Here's the scenario in a world that doesn't yet have our solution. And then we understand the price that we as society are paying for lack of your solution. And then you show us your solution, then we understand, because then we can compare how it is now versus how it'll be with your solution, right? Okay. And just another word about competitive landscapes. So one possibility is really showing a table and saying, these are other companies doing something similar, and here's what they have, but here's what they don't have that we do have. That's one option. But usually in a short pitch, I would recommend that if the purpose is to say all of these three other companies that are offering some sort of platform to support families of children with disabilities, but none of them offers the personalized care, you could cluster all of them together instead of detailing them in a table and say, today, there's a category of applications that offer X, Y, and Z, but not the personalized profile for collaboration between all the stakeholders. We're creating a new category in this market. So then it's all of them that offer some things, but not this. And this is a whole new layer of a solution. Okay, super. Thank you so much. Great. We'll work on it. Good luck. Good luck launching the MVP. Do we have time to hear from one more friend?
No, no, it's enough for today.
Okay.
Dafna, your feedback and advising, and also regarding the next session between you and the participant, the one-to-one session. What you are going to offer them? Because most of them they are ready. So
Okay.
we can start this week or early next
Yeah.
week.
Great. So, all right, let's do the following. Why don't you connect us individually, either by WhatsApp, by email, whatever's convenient for you, right? So here's what I recommend that we do in the one-on-one sessions. I recommend that you set a one-on-one session with me at a time that you have already had the opportunity to create some sort of draft presentation, right? And we can start the session by you presenting to me the draft presentation when you're giving me the background of who it's for, right? Which audience it's for. Now, Sheffield, do you want all of them to be working on the presentation for the upcoming events of the program and thinking about investors?
End of October, we have the three sessions with the investor. Shiba, Shard Sadiq, and also with the Deloitte. So we need to prepare that. And regarding the time, that we're talking about 4 minutes or 5 minutes.
4 or 5 minutes.
So they should be, yeah.
At these events in Shaare Zedek and Sheba, Sheffield, in Shaare Zedek and Sheba and Deloitte, is there also going to be Q&A after each presentation or not necessarily? Can they count on the fact with plus Q&A?
But is it relevant for us, like this session, or Dr. Musallam? But of course, it's relevant because he has the product and he also
He's ready.
He's ready, and
Yeah,
he's doing it by himself. He's not working in another place. Like I'm working in Hadassah. I can't have an investor
agree.
like without going through Hadassah.
Our role, Dr. Ashraf, is that we are preparing all of you to present in front of investors. At the end, it's up to you. It's a very good question because the progress of each participant is totally different. I totally agree with you. And there is case by case, and your case is totally different than Dr. Musallam or Laila or the other. But regarding the presentation, we are preparing all of you to present in front of the investors. And what makes it's different. As some of the participants know, we started with Yeshiva, for example, the marketing plan. It's till the end of this year, end of December. We talk after that. So it depends on each startups, each participant, case by case.
Let's put it this way. If you're very, very early stage, we can work on how to present a very early stage idea.
Important thing.
Yeah, no, with you it's fine because
Yeah.
it's interesting first of all, and but for the investor to present for the investors,
You can
I-
present
I-
from yes.
I think it's not relevant for me at all because even if I have a product, I can't present it for any investor.
Case by case. We'll discuss it. Agree. Totally agree. At the end, totally agree with you. You are right. We need to talk about the patent, about the registration, about the FDA. You are right, totally right. But here, what I'm preparing the presentation in case that you are ready.
Mhm.
And what is the difference between each one? We'll talk about this later. Totally.
So my recommendation is that you can tell everybody who is going to be setting up a one-on-one meeting with me
Yeah.
that that they can schedule it for a time that's convenient. We can be in direct contact to schedule the timing as everybody wants. You can tell them whether you're allocating one session per entrepreneur or whether we'll follow up with a second session for those who need it later on.
It's all fine, by the way. Yeah. But yeah.
Yeah.
You can come have coffee with me in Arizona if you want.
The French is yes, it's a review by the
Yeah, I'm totally local. I'm totally local. Yeah, so I would recommend that everybody plans to use the hour now that you have a sense of what it is I can potentially help you with. I would think about a specific scenario, and what Jaffel needs right now is for you guys to be ready for these presentations of the program, right? But of course, we can comment on other presentations that you're preparing for other specific audiences. But we're thinking about a specific entrepreneurial project for a specific target audience for a 4 or 5 minute presentation that would potentially have Q&A afterwards. So I can also help you think about how you would like to answer questions short and to the point, right? But I think we're going to focus on logical flow and structure and minimal content written on the slides and what kind of visualization with graphs, or other kind of illustrations would be a helpful visual representation of the functionality that you're talking about. And potentially, Jaffel, if we're going to follow up this session with a second one on the 15th, maybe, then we can also think about what would be the most helpful way of having that session. Maybe that session will be totally your presentations. And then you guys can come to that session, each having already sent Jaffel your updated version of your presentation that you've already practiced and you know it's your 5-minute version. And then we'll have time for everybody to present a 5-minute presentation, receive suggestions on how to further upgrade it and sharpen it. And then that's what we can devote the session on the 15th to if you guys want.
The 15th of this month, yeah?
I think Jafel's going to finalize it, right? 2 weeks from today, right? I don't think so.
عشان نحن بالذات عندنا سيشن جديدة عشان اي بي and legal هذا السؤال للدكتور اشرف. But in all cases before the end of September. We have the when it's
Now that you're enrolled in the yeshiva program, you should know.
We'll discuss it with the student.
Exactly, an advanced yeshiva student.
I would suggest if we make it a bit later than the 15th. Why? Because
End of September, you mean?
yeah, why? Because it will be a good chance for us to prepare according to these things that you gave us today. Because for me and for all of us, I think if we have all these data, all this setup in hand before, in advance, that will help us present many good things and will be one step further. So if we delay it a bit, at least 1 week, that will give us a chance to prepare our presentations very well. And then we can do it once again, and you can give us also remarks on that session, in addition to one-to-one, let's say, mentoring or let's say help.
This is tomorrow, it's very important. I think what Dr. Ashraf mentioned, because we have 2 important sessions, the patent and the registration and also legal issues. We'll discuss this the next 2 weeks. Actually, schedule this week.
Yeah, because all these
But we'll have to be
online. We will
But no Wednesday.
No, it's not Wednesday. No. Wednesday done.
Done.
We're talking about Mondays only.
What did they do? What did they do? Okay.
Not Wednesdays.
بس بكره يعني تخريج الليدرشيب انتم كلكم اشتركتوا بالليدرشيب وشهاداتكم جاهزه. Tomorrow we have the graduation ceremony.
Congratulations.
And yeah. فانتوا بشرط كليتهم بكره كنتوا موجودين قلتوا شهادات يس ما هو كان بالسيشن تبعنا يعني شهر 8 طبعا لا انت
ظافر انت انولدت ليدر.
الله يرضى عليك يعني
Thank you so much all of you for what you're doing.
لا هبدا احط شهر 8 كل السيشنز اللي كانت موجوده كانت ميكس مع الليدرشيب. هلا انا سويت هذا من تجربه السنه الماضيه لانه كل مواضيع الليدرشيب فت لكم الستارت اب انكيبيشن. فانتوا اوريدي مشاركين ولكم شهادات في الليدرشيب. بس مش لك شهاده.
Thank you very much. It was very nice. Thank you very much.
في انفاك كمان بكره.
Thanks for the important work you're all doing.
אני טועה איך אני יכול לעשות את המצגת הזאת, שאין לי אדרמנטור, אין לי דעה עכשיו. עכשיו על אולי דיווייס, אבל יכול להיות שזה משהו אחר. יש לי איזשהו מנטור שעובד בביולוגיה, עובד במיקרוביולוגיה, אז יכול
להיות שמה שאתה מדבר זה לא device אלא סוג של בדיקה.
בדיוק.
שמה שזה יהיה בדיקה שיודעת לזהות סמנים, שיודעת לזהות ביומרקרים בשלב מוקדם יותר מאשר הבדיקה.
המחשבה שלי לא להמתין לתרביות, שלוקח 48 שעות. איזשהו סימן שאפשר.
אז מה שהייתי עושה בשלב כזה, זה שהייתי מבנה את הצורה של הפרזנטציה, את הרצף שלה. היום UTIs הם בעיה ארוכה, מעצבנת, שאנשים שפוגעת לאנשים באיכות חיים. הסיבה העיקרית לסבל של האנשים זה העובדה שזה מאובחן ממש לסבל שכבר יש להם את התסמינים המציקים, ולכן אין ברירה אלא לקבל עוד פעם אנטיביוטיקה. מה אם היה אפשר לזהות את ההתפתחות של בשלב יותר מוקדם או לפני שהם מרגישים את הסביבה, את הזימום, את המצב
סוג של אינדיגרציה, בשתן הזה מתבשל.
האם יש כל evidence base שאומר, אכן יש אינדיקטור ויש ביומרקרים מקומיים יותר, וזה עניין של לפתח בדיקה שיודעת לזהות אותה?
בדיוק, פירוק של בקטריה, פירוק של חלקים של בקטריה, משהו יותר מעניין, זה לא סתם בקטריה, צריך לקחת, בוא נגיד, 5 קופים של הזורמים או של החיידקים הכי נפוצים, נגיד, אוקיי, עכשיו יש לך הגדלה של איקולי, שיש לך הגדלה של צלפנול, זה שמות של חיידקים, בקטריה כבר להתחיל או לטפל או לשתות יותר.
מצוין. אז אפשר להציג את הקונספט עוד לפני שאתה מציג, אז לא יהיה לך את מה או הפתרון זה יותר עובד. זה יכול בשלבים להגיד, ואני חושב על כיוונים שונים. איך זה ייראה, האם זאת תהיה בדיקה מוקדמת, האם זה יהיה דיווייס, האם זה יהיה... אבל שהמטרה זה לראות בשלבים מוקדמים, באמצעות הביומרקרס המוקדמים ביותר שנקראו
הוא שלח כולם
اشتغلت موجود بس مش ذاكر. كل سجل شهر السنة الماضية أصلا بس يعني بشعر اهلا وسهلا
خلص الشهاده هلا
والله مش هصير طبية عنكم مين كيف بحكي
اوكي انا لازم انزل لما الجماعه يفهموني
اول شيء
هلا انتوا Dafna, you are going from here?
Yeah.
With the ruler?
Great.
Yeah.
Thank you.
Rula, take care of Dafna and she will take care of you. Regarding the presentation.
Thank you.
She's going to,
To the train?
no,
But
you are
to the
going
same
there
bridge?
home.
Yeah, but I'm going back to the light rail because my car is in Southline. I need to go back to the
Ah,
municipality.
ميدان صفرا.
Yeah,
رنا لبست ميدان صفرا. كيف كان تكمل؟
I'm just going back to the light rail. אני הולכת לקשר בעירייה. אני הולכת לרכבת. זה הכיוון שלך גם ככה? אני...
Thanks so much.
Thank you very much.
My pleasure. Thank you.
What you're doing.
Thank you.
أنا ظافر حبيبي.
كنت تسألني شو؟
To check your schedule.
So maybe we'll do later than the 15th.
We are talking about
One of the other Mondays?
no, Monday. I think
حتى وانا
because we have yeah. Dr. Sliman and Amjad they are not here, and they are there. So can tomorrow just with
Scheduling. Great. So we'll already set our first meeting with me for tomorrow. Does that make sense? That you wanted to meet with me already tomorrow?
Yeah. Because just a minute. So, because as she mentioned, that she's really